Welcome, everyone. We still have a bunch of people that are entering the meeting room, but it is 10 o'clock and I want to respect everyone's time. So we have both our co-chairs on here as well. So I think we can go ahead and just get started with the logistics. Just a few reminders. This is a board meeting, so we are very excited to have members from the public join us. But if you would like to make a comment during the board meeting, we do have time for public comment about halfway through the meeting. If you would like to make public comment, then we ask that you email Nicholas Colgan, who's our administrative coordinator. You can see his email on the screen. And if you are on the phone by chance and can't see the email, you can go to our website, which is DCYF Oversight .wa.gov, and you can find his email there, and just give him a quick email and let him know so he can go ahead and manage that time accordingly. If you are joining from the public, you are welcome to introduce yourself in the chat box. We do have the chat box. We should have it open. I'm not sure if, Nick, can you make it open for this introduction part, possibly? If you'd like to identify yourself, you're able to do so in the chat box, but you are not required to do so, so that's by choice. During the meeting itself, we will lock down the chat box, so only messages can be sent to Nicholas or myself. It's just to help manage communication, make sure that everyone that is joining by phone or by video hears everything that's going on in the meeting. For board members, if you do have a question throughout the meeting and would like to be called on, you can notify us and we will notify the co-chairs of that, but we also encourage board members during question time to just go ahead and unmute yourself and ask those questions. Due to some feedback, we have allowed for a lot more question time during this meeting than previous times. So with that, we'll go on to a quick, I just want to do a quick few announcements, which is to say, we are reimagining a little bit about how we're doing some board member engagement through the planning processes for these meetings. The co-chairs will talk about this a little bit more extensively, but I do want to acknowledge and thank Lois and Diane for some of their engagement in the planning for this meeting early on. And we will talk a little bit more about how we can further engage board members in the planning process. And also just some considerations of how we revisit how we're doing the oversight work overall. But again, the co-chairs will have much more to talk about that in a minute. And just another reminder that we do have co-chair elections in November. I believe we are going to schedule that meeting to be November 5th, and we will update board member agendas or calendars accordingly very soon here. And with that, we'll go to the next slide to do a quick agenda overview before we do roll call, request for approval of minutes, and then I'll pass it over to the co-chairs. So as you can see today, we are going to have a focus on an early learning and childcare, particularly licensing and regulation enforcement. The co-chairs will have a few minutes for some opening remarks and some reflections. We will then hear from DCYF from Travis Hansen and Tyler Farmer about licensing and regulation enforcement changes over some time. So we're going to get an ARC story of how they were, some changes made by feedback that they've received, what's going on during the COVID pandemic, and then looking forward with those licensing and regulation enforcement changes. We are then very fortunate to have a robust provider panel with us from child care providers. We have Lois Martin, our very own board member, who will be facilitating that panel and will also be contributing to answering some of the questions we have regarding that in reflection of what we heard from DCYF. And then we'll go into a short break and then come back for public comment. We are then going to have about 30 minutes to allow board members to ask DCYF about anything that came up during that provider panel. So really kind of figuring out if there is concerns or issues raised, how does DCYF plan to address those, or have they in the past? And then we'll go into a short time period to do an initial review of a raw annual draft report we have for the board. And then we'll go into some closing remarks and talking about our next meeting. So with that, I'm going to do a quick board member roll call. When I call your name, please just go ahead and unmute and say you are here or present. Katie Byron.
Present.
Annie Blackledge.
Present.
Senator John Braun. Bobby Bridge.
Present.
Senator Jeannie Darnielle.
Okay.
Is that Senator Darnielle, are you on? Did I hear someone else? No, okay. Representative Tom Dent. Sydney Forrester.
Yeah, Tom Dent's here.
Oh, okay.
Yeah, sorry.
No, it's okay. Sydney Forrester. Lonnie Greniger.
Good morning, present.
Good morning, Lonnie. Ben DeHaan.
Good morning, Ben Gihan here.
Thanks, Ben. Co-chair Ruth Kagi.
Present.
Annie Lee.
I'm here, thank you.
Dr. Diane Levy.
Here.
Charles Loeffler. Okay. Lois Martin.
Present.
Thank you. Shonda Slivanoff. Representative Tana Sen and co-chair.
Here.
Thank you. Wendy Thomas. And then Assistant AG Stacia Holler, I think you are on as well. Just want to let the board know if you are.
Yes, I'm here.
Thank you, Stacia. And with that, we will do a request a motion for consideration of approval of minutes. Nick will pull those up on the screen, but also board members should have them in an email they received last night and the week before.
This is Bobby, move to approve.
Second. Any comments on the motion before us? Any comments on the motion? All those in favor of approving the August minutes, please indicate by saying aye.
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 Any opposed? Or abstentions? The minutes are approved. Thank you.
Thank you very much. And with that, I'm going to hand it over to the co-chairs for opening remarks.
Wonderful. Welcome, everybody. Nice to see you all. I trust that you're not getting too smoked out. People are wearing masks for yet another reason. And that I appreciate how much that you're joining us all with what is going on in the world. So it's great to see you. We know that the challenges for our kids and families continue, if not even more exacerbated with all that is going on. So our work here is even more important, and if it even seems possible, taking on even more of an emphasis and importance. So again, can't thank you enough for being here. So before we get further into today's agenda, I just did want to make a couple brief remarks about a recent article that came out in Investigate West about foster youth and those staying in hotels or at DCYF offices. I was interviewed for that and had done, of course, a lot of background research and a lot of work on that in general. And, that's a very complex issue, an ongoing issue. I did just want to make sure that the board knew that a lot of the issues that were raised in that, we addressed some of that during last legislative session with additional funding for BRS and some new behavioral rehabilitation services, rating kind of levels to create increased bed capacity at higher and higher acuity rates. And with COVID and with the timing of things, those haven't come online yet, but I know the department is working on those, and so anticipate more access to those beds for our youth. And it would be wonderful if we had more capacity at clip beds and in other ways as well. So we're not going to have that on our agenda right now, and which I think gets to our broader question later about what is oversight. But a lot of what is kind of had come up in that article are things that are sadly ongoing, and there have been lots of changes and work to address those, and unfortunately a lot of that does take time. I would note also what I learned and what I thought was particularly interesting. If you look at the numbers of youth who are, most of those kids who are in the foster care and in the hotel and office days are older youth, older teens, if you will. And when you look back at the demographics and what's coming up behind us, right now we're in a spike. And again, if you look back, those kids were were born and raised early during the last recession. And so as we think about this recession coming up, we don't want to make those same mistakes that we did then, where we were devastating resources that could have helped those kids early on and reduce trauma. So I think all of this really does come full circle and is important for us to think about the long-term impacts of early childhood development and how that goes into future years and the impacts of that. So sorry to start on kind of that humbling note, but this is a constant reminder that we have lots of work to do, and just want to reiterate that, of course, all of these children are state's children, and we need to be taking good care of them. So Ruth, did you want to say anything on that topic? And then we'll go back to the childcare topic. You're on mute.
Thank you. The issue of shortage of placement options for particularly older youth with behavior issues has been, it was true the entire time I was in the legislature, and it came from the elimination of group homes that happened over a period of years and really in the 90s. So this isn't something we can quickly turn around, but the issue has really brought to the floors have discussed in previous meetings, the need for us to really define what oversight means. Does it mean responding to an immediate crisis? Does it mean holding the department accountable for what's in the legislation and various laws? Krista, Representative Sen, and I discussed how we should approach this, and we, especially two members, specifically requested, Lois and Shonda, that the Oversight Board take up the issue of oversight and what it should mean for this committee. So we would like to create a subcommittee to meet between now and our next meeting to really talk this through and to come up with some recommendations for the board to consider. So we'd like you to volunteer if you would like to join this group. It has to be 8 people or less because of the Public Meeting Act requirements. Hopefully we won't have every member volunteer, but I know it's just a major concern, and it's something that we just need to more clearly define. So if you are interested, please email Krista and let her know, and we will move forward with that in the next couple of weeks. So several months ago, pre-COVID, the Child Care Collaborative Task Force met, and we had a presentation on changes in child care licensing. As you know, one of the primary goals of the legislation creating the department was to change the culture. And the main focus was on child welfare, but there also has been a long-standing issue with licensing, child care licensing in particular, and with the compliance actions that were taken. And at the presentation to the Child Care Collaborative Task Force, Travis Hansen, the licensing administrator for DCYF, and Tyler Farmer, who's the policy program manager, they gave a presentation that to me really demonstrated some very significant changes that I thought the committee should be aware of. We had scheduled this actually for several months ago, but COVID and Black Lives Matter, we focused on some issues that needed to be immediately addressed. So recognizing that licensing and monitoring of licensing has changed dramatically with the advent of COVID. I still think the changes in policy and practice that the department has implemented really will make a significant change. So with that, I'm really looking forward to hearing from Travis Hansen and Tyler Farmer.
And before they get started, or as they get set up, I just, also want to reiterate that clearly there are lots of issues related to early learning and childcare that have been just even more exacerbated with the COVID situation. And we could talk on this topic for hours and hours, and I'm sure we will. And there are lots of venues where we do talk for hours and hours about these topics. So I do want to recognize that we are, today really drilling down and focusing on kind of the licensing and some of that in terms of how that has been a culture change and how that has shifted over the past few years. And so we're really digging down into that. I'm sure some other issues will come up, and we'll talk a little bit about some COVID impacts, but this is also just want to, make sure that we're realizing that we're also asking people to look back pre-COVID, which is sometimes hard, but very important to also just see those changes, recognize them, and see what else we need to do moving forward. And so again, just want to acknowledge that there's lots of issues in this space in and around the department later today or soon that we can talk about further, but right now we're focusing on this aspect. So again, thank you for everybody for being here today, Travis and the panel that will be coming up afterwards as well.
Okay. Go ahead.
No, I was gonna turn it over to Lois, but she's the next part. So Travis, onward.
Well, am I running the slideshow? Or is somebody going to run that for me? That would be my first question.
Yeah, we were going to give you ability to run the slideshow from your own desktop. If there's any issues with that, then we can go ahead and do it ourselves.
Okay.
But you should have the option to do it, because I think Nick just signaled that you can do so now.
Okay. So let me see if I can do that. So I'm hoping you can see my screen now.
Yes, we can. If you want to go into, yep, there you go. But yes, we can see your screen.
Okay. All right. Well, first off, thank you for having us. We were supposed to do this pre-COVID, and that didn't work out. And so some things have kind of shifted here. My name is Travis Hansen. I'm the Senior Child Care Administrator. So my business is that I oversee child care licensing, as well as the exempt services with the department. And then Tyler Farmer is also going to help me present, and I'll let him kind of explain his role at the department.
Hi, good morning, everybody. Can you hear me? I'll test that first. Yes, I see nods. Wonderful. Yes, I am the Licensing Division Policy Program Manager within DCYF, obviously within the Licensing Division. And I'm involved in all things programmatic changes involving the WAC and regulatory compliance. So I work with Travis very closely on all these new programs and new changes.
All right. So what we kind of want to do is give you a view of what we did pre-COVID and talk a little bit about that. And there's so much there, but then we also want to give you an idea of what we're doing right now with COVID and just give you a brief overview of some of the things that we've been able to do. And then we want to look at after COVID or down the road, what we plan on doing with childcare. So let me give you just kind of a scope of our services first. So we license centers, school age programs, family homes, and then we have a pilot program that is our outdoor preschool program, which we're very proud of. And if you would like, I would be more than willing to come back with some folks and we can go into depth of that, because I think that the outdoor program is a huge program that could help with childcare. But I don't want to get into depth there. There's some numbers on the screen. You can kind of take a look at that. We will also provide this PowerPoint to you so that you can kind of dig through it as well. I also put up on the screen there the family, friends, and neighbors. So that's an exempt service. They actually don't need to be licensed, but they are a huge component to the early learning and child care programs, because some parents make the choice to have folks watch their children that are friends, family, and neighbor. All of that program is 100% subsidy, and that's why it's a huge thing for us to track, because those are the kiddos that we want to track as they go into get ready for school readiness. The other thing is that the feds made it a requirement for us to monitor these programs. So we used to not have to monitor them. And when the feds made that decision, that's when we kind of brought them underneath our umbrella to monitor them and look at it. So again, that's a whole other program. I can go deep into that some other time if you want more information of that. You can see that the average capacity for centers, school age programs are at 69 children. The average capacity for family home providers is roughly 10. Also keeping in mind that the max that a family home provider can have is 12 children in care. Just a little statistic around subsidy: 91% of centers and 79 family home accept subsidy. That's a huge deal for us, because we want all providers to take those kids so that kids get quality child care. So, excuse me, moving into some of the standards alignment stuff that we did over the last years. The Early Start Act was a mandate for us, DCYF, we were DEL at the time, to take the standards of child care licensing and put them all in one group, right? So take family home, take center, and put those together using, early achievers as the quality standards for the framework. So really what it is that you have licensing is the base, and then you build on that with early achievers, and then, with the early childhood education assistance program, right? So one builds on the other is the idea, is what we needed to deliver. And we had some amazing leadership at the department with Luba as well as Ross with supporting us through this process. And it was a heavy lift for us is what it was. So one of the ways that we got there is using the framework of negotiated rulemaking. And this process, when it started, I didn't think that we really knew what we were going down, but what it turned into was an amazing process where we were able to collaborate with partners and stakeholders and come together and really for the first time start listening to providers of what they needed as we went through this negotiation process. And I'll talk a little bit about that in a couple of their slides. I'll go a little bit deeper, but really what came out of that was this opportunity to us to listen to the people that are doing the work on the ground and hear what they're saying, and really look at the standards and write those standards so they're best for kids is really what it was. We implemented those new rules in August of 2019. So with the idea that we were going to have this transition year, and what happened was COVID happened. So we got some small data, but not enough to really look at the work that we had done to really break it down to look at it. So we're hopefully in the future, we'll be able to get some more better data. We really had to pivot, and we'll talk more about that, what that looks like as we had to pivot with COVID in child care licensing. All right. So standards alignment and the process. This started back in March of 2015 is when we started this. And it really took a life of its own. We had tons of people come to the table and start working on this, trying to rewrite these standards and put the best quality standards forward for kids. We had experts from the field all over the state. We had national consultants come in and help us with some of this. But it truly was a collaboration with everybody. And again, the community feedback was huge. Over 1,000 people had input on this. And that was really us kind of saying, okay, we're going to listen to you in here. Not that it means that we were going to do everything that's the information that people gave us, but listening to folks of what they really needed and being able to do that. So negotiated rulemakings. It was a 10-month process. I was fortunate enough to be part of that process where we sat in rooms and negotiated and found common ground on most of the issues. There was 5 different stakeholder groups that were part of it. So family homes were represented, centers, ECAP Head Start, parents, and then, like I said, there was a licensors sat at the table to negotiate these. I really think that by us going through this process, it really helped the department to be able to listen to providers and start that dialogue, which continues today. We always came and sat down with the family home folks with SEIU, but there really was a miss to center providers and hearing center providers voice and that. And I think that, we have tons of work to do, but we're able now to listen to them, have regular meetings, hear what they're saying, and get feedback with them. And I think that's one of the most important things that came out in negotiating the rules, as well as some amazing standards for children in Washington State. That people did an amazing job writing them and really looking at them, and understanding what we were trying to accomplish with writing these standards. So the other thing that we did out of that was this collaboration having to do with training, and what we called it was a deep dive learning opportunity. So there was a number of in-person trainings around the state. There was a number of online e-learning that folks could do. So if they missed the in-person, there was another way to get to it. It was in multiple languages. A lot of this work was done on the weekends and the evenings. So you would have providers that would work a whole day and then be eager to go learn or show up on a Saturday, when that's, one of their only days off, and really buy into what we were doing. So that was neat to see. The other thing that was important is that when we wrote these standards, what we did is we had to retrain all of our licensing staff across the board. So one thing that we did with the deep dive trainings is that with those in-person trainings, we had licensors come to the table with providers and sit in the room and learn together, which was really the first time that we kind of had leveled the playing field for licensors. And what we said to licensors was, yeah, you're not the expert here. You're going to learn with providers. And I think that was important because that started that partnership as we shifted to, a new way of doing licensing, that it really showed folks that we wanted to come to the table and, kind of take that, that rough enforcement approach and put that aside and really show that we really wanted to work with them. One of the most important things that I also think that came out of this process was waivers and variances. So what we were hearing from folks is that there wasn't flexibility in the standards, and there wasn't a gray area. And so what we were able to do, we always had this exception process with licensing, but it wasn't used the way that allowed folks some flexibility. The waiver process allows that. So what it allows is that a provider can ask for a waiver from the standards or the rules. And it gives them that flexibility to be able to run some of their programs. So a good example of that is qualifications, right? You might have an amazing director, but they might not have the qualifications. We can do a waiver to waive those qualifications, and maybe then set up a plan of how they're going to come into compliance at that point. The other thing that came out of it was a variance. So a variance is a great tool that we can use now. We can use that variance is really what it is that it's their methodology of how they run their program. So the example I always use is Montessori's, right? They do a lot of mixed grouping, and that is their methodology. So that matches with that, so that they could do a variance to say, okay, this is how we run our programs, and we run to a lower ratio to be able to meet that, and then they can have that. Now, I use that example, but it's kind of outdated, because one of the processes through this negotiation and rewriting these rules and the standards is that we were able to listen to folks and fix a lot of the things that needed to be fixed, so that there've been less variances that folks have asked for. There's still a lot of waivers that folks ask for, but there's less variance, but we still have that tool to make licensing a little bit easier for providers. The other thing that came out of all this is that we got a new monitoring system, which is called Walk Compass, which allows us to track a lot better data in the work that we do. So we can see which WACs are being cited the most, or which standards, are spiking. And then when we go to make adjustments, we can use the data that, hey, this is a WAC that we need to fix, right? And that's another thing that came out of it that really helps. Or the other thing is being able to track waivers and variants and see the inconsistencies and say, okay, people are asking for waivers a lot on this issue. Why don't we rewrite that WAC or fix that? So. Excuse me. All right. So guidebook. So we're currently working on a guidebook for providers. We've had guidebooks in the past. We had a family home guidebook. We had a center guidebook. They were very outdated. I think the center guidebook is like still on a CD that is provided to folks. So it's very outdated. So we are in the process of moving this guidebook forward, which will be an interactive guidebook that is online. There's currently chapters that are already completed, and what folks will see is those chapters, more will be added to it. It's a great reference for people. It also allows us some flexibility. We can't translate the WAC into other languages, but the guidebook is a really good resource because we can translate that. We can translate some of the stories that we've gotten from providers that are in there, some ideas, about how to come into compliance. It just gives them a reference that they can go to. It's online, it's interactive, it takes you to videos, it takes you to trainings, it takes you all over. And there's actually a link in this presentation that you can go and look at it. Again, it's not completed. We just have a couple sections completed, but we're hopefully that will be completed by December, which gives a great resource for providers to go to use. So now I really want to kind of dive into this, and this is, I think, where why we got invited, was this paradigm shift of the way that we kind of do the work that we do. And so we had this practice of see it, cite it. So we would show up to a facility, we'd have our checklist if it was in, and we would start going down that checklist, but we would start looking around the room to find things that were out of compliance. And if we saw it, we cited it. We made the shift to assume compliance. Yes, there's providers that aren't the best, but there are also providers that want to do the best, and they're trying to do the best. And if we come, to the facility to monitor them, what we really need to do is assume compliance. We need to assume that that individual has the best intentions and wants to meet the WAC. So what we did is we did a differential monitoring approach is what it is. So our licensors are now trained to stay to the checklist unless they see something immediate that needs to be dealt with, which helps because it guides the conversation. The other thing that we did is that we did risk levels to all of the standards. So there's a risk level attached to all the standards, which it's almost like the keys or the, it helps providers to know which WACs are most important, which of those standards are most important. So what we have is we have immediate concerns, which are your high risk kind of situations, child escapes, abuse, neglect, the big things that are really important that folks meet. And then you have your short-term items that are kind of the immediate, and then you have a long-term, which are a paperwork or something, something small that there's really low risk there. And so what we're able to do is, one, it helps us to concentrate on what's most important, which all of the standards are important, but there's a different risk to each one and how we deal with that. And then it also gave us some tools so that we knew if it's immediate concern, if you have a child that's walking out the front door of a facility down the street and is gone 2 hours, our response is going to be much different than somebody that forgot to post a paper, and what we're going to say is, here, let's give you technical assistance. Do you have the paper? Make sure it's posted or make sure that's done. Those are two different ways. And a lot of times we were responding the exact same. And so this really allows us some flexibility to have some tools in our toolbox to really help providers, and we can say, here's technical assistance versus, okay, here's an action and this is the why we're taking the action to that immediate concern. And it really helped us kind of focus, what we were doing. Tyler, do you want to add to that?
Sure, I'll add briefly. I started with DCYF and Dell back in 2016, and so I pretty much entered on the ground floor of this paradigm shift of how we approach oversight in licensing. And because of that, I got to be very involved with it. And it's been amazing the amount of work that was done here. The negotiated rulemaking, where we literally rewrote the book of rules with stakeholders. We got an enormous amount of agreement among the rules. Out of 116 rules, we got consensus on 110 of them, which is phenomenal. Which is hard to do with 50 people in a room, get consensus on a law. And then part of this is the oversight approach. The oversight approach where we—
Donna, sorry, excuse me, Donna, can I ask you to mute your phone, please? Thank you.
So this new oversight approach, we really went back to the drawing board and realized that DCYF was created by the legislature and given a purpose to make sure that there is high quality and healthy and safe childcare out there. But along with that, they gave us a toolkit, and we wanted to make sure that all of our tools matched the appropriate time. And that's really what our new approach to oversight compliance is here, and we can dive into more detail with that. But that's sort of the idea to keep in mind. And Travis, if you are ready, we can move on to the next slide.
Yep.
All right, thank you. So still talking about monitoring and compliance of oversight, along with this new approach of oversight, with this new coaching approach rather than the see-it-cited approach, where we're providing technical assistance, where we are coaching people up rather than just looking for violations. We also completely revamped the dispute resolution process. If a provider doesn't agree with an action we're taking, they now have many ways that they can dispute that or try to get that overturned or at least contest something that we do. The original bill that created DCYF added an additional dispute resolution pathway, which is the internal review board and then also this oversight board here, which is something that we are completely behind, and we're happy to build that into our systems. But there are also additional pathways. One is internally through the DCYF centered, what do we call it? The compliance process, or I'm sorry, the violation dispute process, where we have statewide DCYF licensors and supervisors reviewing decisions of other areas if a provider chooses to go down that path. And then also that is what is always available is if the department takes an action that impacts somebody's due process rights, which are very specific, that provider can then go outside the department to the third party of the Office of Administrative Hearings and seek legal review, where if they get a fine or if their license gets impacted in any way, they can contest that through the Office of Administrative Hearings. So really, through this entire paradigm shift, there are 3 different pathways that a provider can contest any sort of legal action or non-legal action we as an agency take. And there should have been a handout provided to this group. It is called the Understanding Childcare Licensing Compliance. Very detailed, very technical, and we can dive into that later if needed. But keep that in mind as far as oversight and dispute resolution. There's a bunch of different pathways that we designed for providers to be able to take if they so choose. As Travis mentioned, we don't have a ton of data, but some of the data we do have is pretty impressive, and we're happy to see where things are going. For instance, there have only been 3 licensing scenarios that have risen above the supervisor review, the internal agency process. Only 3 in the last 2 years. And all 3 of these only went to the statewide child care violation dispute process. So that is the internal DCYF process, where we have a statewide group of supervisors looking at actions to make sure that we're applying rules consistently. None of these providers chose to elevate the decision higher. They chose not to go in front of the internal review board, which was created in the DCYF statute. And just as a reminder here, the internal review board, according to statute, is staffed by 3 DCYF employees and 3 child care providers submitted by this oversight board. They get to put names forward for the internal review board. And additionally, in 2 of those 3 cases, the dispute process, the violation dispute process, overturned the action that the local licensor took. So the system is working. The provider asks for some additional oversight. They don't feel something was quite right. And then it goes to this statewide violation dispute process. And we're able to correct some errors if they happen. And I have one more slide showing a little bit more data. If we go to the next one, slide number 9. So I mentioned that anytime a provider's due process rights are impacted, they have a pathway of going to the Office of Administrative Hearings, or OAH. Just to remind everybody that OAH is an independent agency. It's a third party. It is not part of DCYF. It is the agency staffed by administrative law judges, and they adjudicate decisions of agencies, actions of agencies. And so I reached out to them to get some data over the last 5 years, and this is what they gave me, which I think is really impressive. A couple points here. I don't need to dive into the data too closely, but two things. One, there are a very small number of legal actions overturned by the Office of Administrative Hearings. So they're looking at us as an independent party, looking at our actions, and they have the power to say, yes, you did this appropriately, or no, you did not take this action appropriately. And in the last 5 years, they've only overturned 3.5% of our decisions, our legal decisions, our due process decisions, as I mentioned. The data here is broken out basically in the before times when we were DEL, and then also after July 1st, 2018, which is combined DEL and DCYF actions. And the other point I want to make is if you look at the middle column where it says total under DEL and then total under DEL plus DCYF, the number of legal actions, the number of enforcement actions we've taken since we've become DCYF, since we've undertaken this paradigm shift, has been cut in half. Drastic reduction of the times we've denied a license, revoked a license, suspended a license, or issued civil penalties. And that's worth noting. That's data that proves that our coaching approach, that our partnering approach towards compliance, that our assumed compliance approach is working. And we are getting and maintaining high quality childcare without having to use the hammer in our toolkit. The next slide, we're going to change topics a little bit. I'm happy to answer questions and dive deeper into this later on, especially about the dispute resolution process. So hold on tight. If you have any questions, we'll get to them a couple slides from now.
So I kind of want to talk about, real quick, give you an overview of what we're doing during COVID right now. You know, everybody had to kind of pivot of how they did their work, you know, and we had this major crisis that we were trying to deal with back in March. So one thing that we did is that we were able to put emergency rules in place for an emergency licensing process. You know, we were able to look at the rules and really dive in and try to set up. The reason why we wanted an emergency licensing process is that the thought is that we would have some service deserts out there, where that we would have communities that would not have any childcare when the schools closed down, or when they decided to send kids home. And so we kind of pivoted and we went that direction, thinking that there would be a lot of people that would come to us and say, okay, we want to be licensed. What actually happened is that people came to us and said, okay, this is what I want to provide. And we could give them a path of what was best. Some chose to do an emergency license. Some chose to get licensed because they were planning on doing it long term. Others decided, hey, I'm going to run a seasonal camp here to just help out with kids. And then we saw, you know, schools step up and do some essential childcare stuff. And so we really didn't have the void that we needed, but this is a great tool to have for when there are emergencies, to be able to issue an emergency license. And so we're planning on keeping that because we think that we can use it. We also think that we might use it as we get in, as we kind of move through COVID. There could be a period of time where there will be more need for an emergency license. You know, the other thing that we did is we had conversations with people that were coming to us and saying, okay, I want to do this. We said, okay, well, first off, is there childcares in your area that are empty, that are low in numbers? And we want to make sure that weren't putting childcares out of business. So we had that conversation with them first. And maybe it was just guiding people to the right childcare because they were actually open and they had openings. So we wanted to check if there was a need. And then the other thing is that, do you really need to be licensed? You know, are you going to use subsidies, that kind of stuff? And it was more technical assistance and working with people of what's best to serve their community is what it turned out. And it still is to this day. We still have folks that are saying, okay, there's a need for school age kids right now because they're not going to school. They need us. So we're guiding people through either the licensing process or what's best to serve that community's needs is really what it is. The other thing that we did is that we did an emergency waiver. And it's huge because that allowed us some flexibility here with the standards. So if we had situations where you had somebody that was, you could increase their capacity. So they have a couple siblings that now need somewhere to go because school's closed. The provider could ask for an emergency waiver, and then we're able to grant them emergency waiver to keep those siblings together. Things like that. Qualifications because you're bringing on additional staff. Things like that needed to happen because of the COVID, just DOH guidance. So there was it allowed us some flexibility. So we created that emergency waiver, which gave us a little help there. What we did from a monitoring point of view and licensing is that we started to do virtual visits. And by no means is it a perfect answer to this problem, but it's a start. And so we started doing virtual visits. We thought it was important to keep our folks out of the field as possible to stop the spread, to do our part so that we're not sending licensors in and out of facilities. And then we really pivoted to initial licenses, and how to get people licensed is what we're doing right now. So we started this virtual visit or virtual monitor visit process. Again, it's not ideal. We're working through it. We're doing the best we can. It's been amazing to work with providers. Some of the feedback from providers has been great. They've actually helped us more through this process because they're able to say, hey, why don't I just put you in the corner in the laptop and you can watch the staff interact with children for 10 minutes and then I'll come back and pick you up. So we're learning right along with them during this process, and I think it's going to get better and better. And we're actually looking at what components of this will we keep in licensing. Is there a way to do some virtual monitoring with providers in the future? Does it work? So we're just gathering that feedback right now. It definitely has been a hurdle for us to get over of how to do this, but we think it'll be a tool moving forward. I wanted to show you this graph.
Sorry, Travis.
Yeah.
I just want to give you a time check that you just have a couple more minutes.
Yep, and so I'll speed up and then I'll hand it off to Tyler. So one of the biggest questions has been, are child cares closing? And so what we are seeing is that we're seeing child cares temporarily close. So if you look at the first bar there in March, you see the child care, the numbers there. What we started doing is we started tracking child care providers that have closed but have not turned in their license, right? And so you can see now, I think that what we will see, and childcare was in trouble prior to COVID, right? Everybody knows that. And so what we are going to monitor, are we actually losing licensed childcare? Are they actually turning in their license? And that's what we're tracking. Because I really feel that we have to celebrate the fact that childcare providers, when we were closing businesses down or shutting businesses, they answered the call for essential staff. I mean, they were the ones that were going to work. They were the ones that were working with kids, those essential staff. And we have to, acknowledge that, that they have been they're the amazing people, right? I don't know another way to say it, that they were the ones that were trying to figure out how to do this and take care of kids and give them the care that they needed. So I think that's important to look. We don't know what the huge impact of this COVID is on childcare yet, but we're tracking it and trying to watch that. We'll have our normal turnover where people come into childcare and out of childcare. So with that, I'm gonna pass it along to Tyler to talk about moving forward stuff.
All right, looks like I got about 60 seconds to get through 4 slides. Where are we going? We're going somewhere very exciting. We're trying to be innovative. We're trying to increase our efficiency in how we deliver services. And we are trying to make sure that there's more high quality childcare. The quality stays the same. And we wrote a bill to do just this. So the goals are listed there down below. Let's skip this slide and go to the next slide. What does our bill do? It's a big bill. It's about 66 pages. And the number one thing this bill does is outdoor nature-based childcare. We had a 4-year pilot project. That 4-year pilot project is wrapping up. We are submitting our final report about outdoor preschool to the legislature in November. We're very excited about this. Of the 66 pages of the bill, about 58 of them simply insert the phrase outdoor nature-based childcare into various parts of the law. We want to make it permanent. We see and have learned through our pilot that this is a very good program, and we think it's a solution to a lot of things that are troubling childcare. It increases the availability of childcare. It helps with COVID. It gets kids outdoors. It has a number of health benefits. It keeps costs down. It's been an amazing pilot project. However, our bill also does a lot of other important things. There's some technical things. The second bullet point here, it clarifies that providers can submit their background checks electronically rather than on paper forms. Same thing with applications, stuff like that. Important little fixes that we need to get through. The third bullet point here is something that we could talk about at length, and we'll probably be talking about this afternoon. This is a hyper-technical issue dealing with the definition of facility licensing compliance agreements, inspection reports, the role of the Internal Review Board. We are amending the law simply because, or in our bill, we're asking to amend the law simply because the way the law was written created some internal conflict and contradictions that technically, legally, did not allow the Internal Review Board or the Oversight Board to accomplish what that board was intended to accomplish. The biggest thing is we're simply switching out the name of the piece of paper that board can oversee. Instead of saying FLICA, we're saying inspection report. The content of the paper is the same. We're simply swapping out the title. And that is because of that those multiple pathways for somebody to appeal any action that the agency takes. I can dive into that more later, but that's a technical fix that we're trying to push through simply because there was this weird catch-22 in the way the law is currently worded. Next slide, please. We're trying to be really, really innovative with the way that we are approaching childcare and early learning. We're trying to create ways for family home providers to be more creative with how many ways they can offer care. One of those is the family home hub model is what we're calling it. It allows providers to have more than one family home business without the residency requirement that's currently in the law. We feel like that'll open up a lot more opportunity and allow a lot more creativity. We're also updating a bunch of language that we mentioned, seasonal camps, health and safety standards, licensing requirements, just technical fixes throughout the law to make things work better and more efficiently. Next slide. All right, in addition to what's in the bill, we are pursuing a number of different ideas that we feel will make a big change in childcare outside of the legislation. Number one is getting family home programs in multifamily buildings. Right now, that is a very, very big challenge. We don't see any of those, and we'd like to see more to provide more childcare, to provide more business opportunities to people in apartment buildings, multifamily units, which right now is almost impossible. And that's actually not because of our own laws, our own rules. It falls mostly on local building codes, ordinances, and fire inspection and emergency services rules. So we're trying to get with all of those partners to figure out how to make that possible. The next one is licensing childcare in DADUs, detached accessory dwelling units, allowing providers to be able to use those for more capacity, more childcare. And then the third point is streamlining the fire inspection process. The combination of local governments, local fire authorities, and the state fire marshal's office creates a complex web of fire inspection and oversight, and we're really, really trying to simplify that specifically for centers to get them up and running faster. The last 2 points are, were written into a previous bill last session, House Bill 2619, which directed the department to do two things. One, create a dual licensing pilot, which we're up and running. We have participants, and this is to make it easier for people to hold both a child care license and a foster care license and operate both at once. They have two books of rules that they have to follow, and we're trying to see where we can streamline those books of rules to work together rather than against each other. The last thing is the license transfer process. Before this bill, a child care license was not transferable to another person. Now they are, and so we're implementing the process to be able to quickly and efficiently transfer a child care license to a different party, but at the same time making sure that high quality and health and safety standards are met the entire time, even when this program changes hands. That is it. I talked really fast. I'm happy to dive in deeper on any one of these topics.
You did a great job talking fast and extremely informative. Thank you very, very much. Greatly appreciate that. So after the next panel, we have a few moments of break, but then we also have time for questions. So I'm going to just want to make sure that folks know that there is an opportunity for questions, but we are going to hold off on those to make sure that we have plenty of time for the provider panel. So I am going to ask Lois Martin, Angela Maxey, Mary Curie, Lisa Conley, and Luke Jasmine to go ahead and turn your videos on if you would like, or if you will, please, and join us for this panel discussion from providers. And I am going to turn this over to our board member, Lois Martin, who is going to be facilitating this panel. So thank you, as Krista said, to Lois and Diane for helping coordinate this panel and getting us ready for today. And Lois, take it away.
All right, thank you very much, Representative Sin. First, I want to thank Krista and Nicholas for all their support in pulling this together, as well as Diane and Ruth for working with me and looking at how we wanted this to flow with the with our providers. So I want to start there and then thank our panel. Everyone comes with a diverse background, which they're going to share with you shortly. So for the sake of time, because I want to ensure that we have a chance to go through the questions that we have, as well as allow for some robust Q&A time, I'm going to ask each panel member if they would take a few minutes to introduce yourself. For the sake of making this flow so we don't have any pauses, I'm going to just kind of call on you, and then if you would. So I don't know if the questions are up, but if you would just share your name, the name of your small business or organization, how long you've been licensed by DCYF, well, that's weird. Can you guys hear me?
We can hear you.
We can hear you.
All right, thank you. I just want to ask that the services and programs you provide to families, how long you've been actually working in the field, and just a short statement about how much things have changed for you since COVID-19. So I'll start with Ms. Maxey.
Did you say me?
Yes.
Oh, great. Okay. Hi, everybody. And before we get going, boy, I learned some stuff in that last discussion that I never knew. So we got to talk about some of that. That was fun. Anyway, I am Angela Hicks Maxey, and I am with Tiny Tots. Tiny Tots is 51 years old, and my mom started Tiny Tots. We have been licensed for 51 years. So I have been here for about 25 of those years, maybe longer, but 25 of those years as a working as an executive. I grew up in Tiny Tots, so I have seen a lot. We actually have one of the original license books that actually talks about you could have had a gun in in your premise, as long as you had a safe place to keep it. I was like, wow, that was back in the licensing books. So it's amazing where we have come in 51 years. We have been providing these services that long. And what have we changed? I will tell you that Tiny Tots on March 13th, when the school district closed, went into crisis management. And because we have a nurse on staff, thank God for that, she immediately said, we have to treat this business as though it's a hospital. She calmed our staff down and she said, look, hospitals are open. They're taking care of COVID patients. We can do this, but we have to treat our business as such. We immediately, for 2 weeks, shut down. We got rid of all carpets, rugs, baby dolls, play clothes, took everything off the wall, anything that could hold on to a COVID spore. We had to be able to clean everything. So we are completely transformed. We've been open since April 6th and have had no COVID exposure. Thank God, thank God. Our staff went to scrubs. We come to work, we change out of our clothes, we change into a clean set of scrubs and a different set of shoes. Before we go home, we change out of those scrubs, we put them in a laundry basket, somebody washes all of our laundry at night. You go back into your car with the clothes that you wore because we don't want you to take home any COVID exposure. We wear masks, the children wear masks. We have one staff person we have like a drill sergeant. We have all these sheets. You guys haven't created them, DCYF, but we have. We clean off, we check off the whole entire building hour after hour. We're checking in on who's cleaning somewhere. So we've gone from 52 school-age students to 14, from 5 staff to 4. So you know that's not sustainable. So the only way we were able to survive that, thank God we still continue to get the enrollment. But 2/3 of our staff are still here. 2/3 of the children are gone. That's where we are.
Right. Thank you very much for sharing that introduction. Lisa?
Hi, everybody. My name is Lisa Conley, and I'm with Child Care Resources, and I'm here today to represent what's happening with family, friend, and neighbor caregivers. I'm not currently an FFN caregiver, but I have been one in the past, as many of you likely have been or are currently. And just a reiteration of who those folks are. They're the grandparents, aunties, uncles, cousins, older siblings, good family friends that are taking care of young children. And we figure that at least 25 to 30% of young children in our state spend significant time during their week with a family, friend, and neighbor caregiver. So what we have observed of how family, friend, and neighbor care has changed because of COVID is that, like childcare situations everywhere, it is completely fluid. There were concerns on some families' parts about older relatives and the potential of exposure between households when giving care. We have also heard that a large number of middle school and high school youth have been serving as primary caregivers to their younger siblings or younger family members, sometimes to the detriment of their own remote learning. And we are assuming that in many cases, as with FFN care, is that families are filling voids with family, friend, and neighbor care because their schedules, work schedules are more fluid right now. There, of course, as we all know, is a lack of childcare in general, but in particular for non-traditional work hours, evenings, nights, weekends. And so there's been a lot of fluidity around FFN care, and I can only tell you what we know through the stories we're hearing through the Child Care Aware of Washington call center, as well as through some of our networks with facilitated play groups and our connections with caregivers through that. I would say that I just want to put out there that the information that Travis presented about FFN Care, and just to clarify that he noted there were 4,000 caregivers in the system, and those are just a tiny, tiny sliver of the actual number of caregivers out there. And those are the only ones that DCYF has contact with through the Working Connections Child Care Program. So, yeah, thank you.
All right. Thank you very much, Lisa. Mary?
Just real quick, Nick, can you pull the slides back up, please? For the other.
I have the questions too. Oh, thank you. My name is Mary Curry. I am located in Tacoma, Washington. I have a family child care home. Prior to having a family child care home, I was a center director, to which the late Bishop Hicks was one of my supervisor of 14 pastors, which was amazing, an amazing experience in itself, right? So, so when they decided to sell the building, me and my husband decided to do a family child care home, and I've been here since 2012. So the services, the program you brought. Okay, so even though we are small and we're only 12, I wanted to reach as many entities as possible. So I was able to, I have ECAP, Head Start, military, homeless, and people are like, well, how do you do that with the 12 and Native? So people just, you know, they're referred to us. We see if it's a good match for our home, and then we bring them on in, you know. So and I pretty much keep at my 12 at all times. Now, the changes that were made, I would say, in family child care homes as at first was a lot of closure. I mean, a lot of slots. Families were staying home. When you're dealing with the working child connection community, as we do, oftentimes a lot of those families weren't working, and they didn't have the opportunities because they're service workers. So they weren't working from home like many other entities. They were off. So, and then they were hit with, you know, they got the bonus, which was great. So, but then they got cut from Working Child Connection because of the bonus. So, you know, there was a lot of changes like that. Trying to keep the spirits of family child care providers up has been one of the challenges, I will say, throughout COVID, because trying to work through so many different levels of caring for kids and their families, and just the not knowing. Cleaning for us has been, I will say this, the people that know my husband, Mr. Pat, they know he was a germaphobe before, so we didn't have to do a whole lot of pivoting, but we went out and did a lot of training on how to close and how to clean and how to do that 3-step model, you know, for family child care homes, taking toys out, finding out which ones were prioritized in their programs, you know, making sure that the teachers were, the assistants that come in were safe and felt safe. I know that a lot of the elderly volunteers and elderly entities, all of those people in the program, they decided to step.
Mary, I think you went on mute for a
You
moment.
went on mute. I can't hear her. We can't hear you, Mary.
Yeah, Mary, you disappeared for us for a second.
Okay,
You
there we
left
go.
off.
You're
The
back.
last thing that we heard, Mary, is you were sharing about some of the elderly volunteers stepping back.
yes, so they stepped out, and the ones that were elderly, they stepped out. Providers that have elderly family members helping with them, they stepped out. But since many of the providers lost slots, you know, I mean, it really didn't have that large of an impact. So cleaning, you know, as I'm right on the same page as Sister Angie, in that we have, you know, we just have to do it, and it takes longer. It's 3-4 hours of cleaning. So, and then seeing if we get enough materials to make sure that everything is cleaned at all times. Wiping behind children all the time. It's just, it's exhausting. It is exhausting. We try to keep up, you know. We're staying in there though. So there we go.
Thank you very much, Mary. Luke?
How's everybody doing? I see a lot of familiar faces on here, which is really great. I'm Luke Jasmine III. I'm the owner of Parkview Early Learning Center. There we have Early Head Start, Working Connections, ECAP, private pay slots. We're doing virtual learning for school agers, about 30 school agers. We also do coordinated services where we have specialists like speech and occupational therapy come to us where the kids are. I am also the co-executive director of GLOW, childcare that primarily serves teen parents. We're in our first year trying to get open. There's a lot of hurdles, obviously, right now. But overall, I've been in early learning for about 13 years. What I would say as far as COVID, I echo the same thoughts of everybody that went before me. Specifically to us, we're dealing with a lot of staff turnover during COVID. Typically, I'm able to be out of the class and do advocacy, talk to you guys, as you guys know, but you probably haven't seen me in a while just because I've been actually in the classroom, spending a lot of time in the classroom. Anxiety for families, of the kids, and staff have been extremely high. And this is definitely magnified the lack of access to affordable and quality healthcare for our workforce. In the midst of that, we've had to be more flexible. Changes in rules, paperwork, advocating for funding, pushing school districts to coordinate with us. We've had increased costs for cleaning supplies and PPE, and increased time spent taking precautions such as doing temperature logs. So, you know, this has been a huge issue. And as everybody on this call already knows, we were already in a pandemic or crisis prior to this pandemic. But to end on a positive note, what I will say is what I've noticed during COVID is people are actually acknowledging the importance of early learning. I'm hearing it from Dent to Sen to, I mean, you even heard Travis, licensor, talking about the importance of childcare. And look, we've been doing this for a long time. We've been holding down the state for a very long time. And it's great to have that recognition, but there's a lot of work that still needs to be done. There's a lot of places that are suffering. We need the rules to be lax. We need more funding to be able to continue to provide for the state. So thank you for having me.
All right, thank you all. And I'm going to just briefly, because I know that even though I sit on the oversight board, some board members may not know my background. So my center, Community Day Center for Children, is in the central area of Seattle, an area that has been heavily gentrified and has changed quite a bit, which in turn has somewhat changed the mission of our center, and that the families that we served were predominantly low income and on working connections, childcare and other grant programs. We have now pretty much gone to, this will be my second year where we're 100% private pay just because of the changes in the neighborhood. We provide childcare for children ages 1 to 5, and I have been working as an early learning director for almost 30 years now. Our center was opened in 1963. So my mother, who actually founded the center, and I can share with others about how I got into this work at another time. I know that she knew that Angie's family, so our mothers were in this work together, which is really nice. And how we changed, we closed for 2 weeks, opened back again April 6th, and have been going strong. Started with 8 children, are now up to about 32 full and part-time, and things have changed in just how we've had to operate and being able to find supplies, which is something, a role that I know a lot of providers were hoping that DCYF would assist us with, and unfortunately that didn't happen. So for myself, I find waking up at 2 a.m., if you're looking for something that is out of stock at Amazon, wake up at 2 a.m. You will probably find it, including bleach and some other things. So just a little bit about how things have changed for us. And pretty much the story is the same as everyone else. but our staff is resilient, and we are grateful that we still have the opportunity to serve our families. So I'm going to go on now to question number 2 and ask that we're going to go backwards since you're up now. Luke, I still see you. So if you would, please describe your experience with DCYF. You see all the questions there. So if you could go down there and if you can, I know it's a lot, but if you can try to limit your response to 2 minutes or less, that would be great.
There's always these time limits, guys.
I know, I'm afraid, so.
Well, so going well, even going back a few years, I would say the department, especially licensing, has been more relational and taking time to understand providers, that we didn't open up our businesses to take advantage of people. We actually opened these businesses out of the goodness of our heart. So I like the TA process, and again, how approachable they've been. I do see, and I might go kind of up and down here, but one of the things I think could be improved is, and again, everything that I say is not to be disparaging, I'm just being honest with you guys. So I know there's legislators from both sides of the aisle. As a provider, all we care about is things getting done so we can support the families. So, but what could be improved is utilizing the provider groups to inform policies, goals, and direction. You know, we are on the boots. We are the logistics people. We're the people that make things happen. So if DCYF works with us in tandem to really direct those policies, you'll see stuff that's a lot more successful and cost taxpayers less money. Like I mentioned before, I think our voice has kind of been heard with the formation of the provider supports group. And we would like more things to go to the provider supports group. But again, the relationship, I think I could call Travis. He's actually done a couple events with us across the state pre-COVID to be able to talk to providers. So I think that's great. But again, we need to make sure we're included in a way where there's actual influence. And again, guys, we're business owners. We own businesses. This is what we do night and day. So utilizing us through the provider supports, even this DCYF Oversight Board more would be great. I think looking into the licensing review process. So I believe Tyler said that that's going on. I mean, I'm the president of the Washington Child Care Centers Association. I didn't. So the fact that we don't even know who the providers are on that group, that's very problematic. So because we've been waiting for that group to form. So I think there just needs to be more conversation and us being on that licensing review process. And then the virtual visits, and we've talked to licensing about this, those really need to be postponed as we handle COVID, staffing, and a litany of other issues that seem to arise in this great year of 2020. Thank you.
Thank you very much for that, Luke. Mary?
I would probably like ditto what Luke said, but I would also add that more streamlining of services, OSPI, DCYF, the providers, everyone seems like every time we ask a question, they direct us to another place to go. And providers just do not have the time. I know, like Luke was talking about the how they've been doing the virtuals in a family childcare home, where now they're working with one entity. A lot of they're doing the tours, and the providers are sitting up here going, I don't have 4 hours to spend on this when I'm the only person here. So they put them at a scramble, and they're already overwhelmed with everything that's happening. And so we've been reaching out to superintendents to say, okay, well, can we work with your particular district to see what we can do to get the needed services that we need in our program. We're already utilizing 3 to 4 online portals, you know, from electronic attendance to the food program to assessments, and then to add on the school piece, it's just overwhelming. And so more streamlining so that we can all work together to help these children and these families. Families are stressed, the children are stressed, so we're dealing with this toxic stress that's happening on the providers. So the providers, people need to understand this is really impacting us to the place where we need to be able to reach out and say, okay, I mean, it was good that, you know, we're acknowledged, but we need to take that second step and move further into what really is going to help and support the providers for the sustainability of our economy. So the thing that I think has been well, one of the things that have gone well, I think is literally, when I first walked into early learning, I didn't see licensors as partners or, you know, stakeholders with what we were doing. But I see that now, and I feel that way, and I'm hoping that the providers feel that as well.
All right, thank you very much, Mary. Angie?
I think there was the other person before me, or do you want me to just jump in?
Oh, please.
Which one? Jump in or?
Jump in.
Okay.
Yes, jump in.
All right. So,
Thank you.
All right. I was waiting for somebody else. So let me get my mind together. Please describe your experience. What has gone well? Well, we've been around for 51 years, and I have been around for probably 40 of those years with discussions when my mom was even still alive. And I would say the biggest improvement is around the professionalism of the licensor. You either have a good licensor or you don't. And if you have a good licensor, you have a partnership, you can work with the licensor, that makes life good. You have a licensor that looks at the rule book as this is law and I'm gonna knock this law over your head, then you got a problem. So it was exciting to hear some of this talk today, but we really view as providers the WAC as a law. So I got to get some understanding around that. Do you all agree? And this is a question back. We can talk about it. Is the WAC a law, or are the WACs able to have interpretation with waivers and variances? I never heard about any of this, because the law is the law and you have to follow the rule the way it is. This is why I have issues with it. I don't even like these standard alignment at all. I do not feel like my voice was heard when I said that the standard alignment is not fair. It is not fair for a home provider to be treated like a center. I'm an ECAP provider. I can easily know what family intervention is, family professionalism, a kindergarten transition plan. I know that language. Family home providers, to just slap that on them and make them all required to do all the things that we are with no extra pay. I was screaming to the roof that was not fair. And I don't feel like anybody listened to me. So that's that. The other thing is, I think the professional development, it needs to be flexible. 5 years sounds wonderful, but things happen with people's lives. So what are you supposed to do? You know, so I hear now today you guys have a variance and a waiver. So maybe that's great. But if all the stakeholders don't understand this waiver variance language, then the other groups we're working with, they're holding that up saying, here is the WAC, here is the rule. The other groups we work with, like ECAPs and USDAs and all that. So we have to all be on the same playing level. Is it a law? Is it for interpretation? Can it be changed? So that's where I'm at with that.
Well, thank you very much, Angie, and sorry for taking you out of order. I have written it down, so just know I'll be starting with you after Lisa speaks, so you're
Got
ready.
you.
Lisa, please, would you answer number 2?
Sure. And from the family, friend, and neighbor care perspective, again, FFN Care is not licensed. It's only regulated within the Working Connections program. I think there are a couple of things that could be considered for those that are in the Working Connections program. There were recently, in the last few years, some new rules that were put into place around screening and requirements for training that came down from the feds. However, I think that those rules from the feds were really written for states where there is very little regulation and licensing of childcare, and they were really written for states where what would be considered FFN care there really would be considered needing a family childcare license here in the state of Washington. And so major investments have been made by our state into putting some practices in place to comply with that. And I wonder sometimes if the amount of oversight that we're doing with those providers in the family, friend and neighbor care providers in Working Connections really outspends the amount of investment that goes to these caregivers. Caregivers who are getting Working Connections subsidy are getting $2.65 an hour, which 40 years ago when I was a high schooler doing babysitting, that's not too far off from what I was getting paid, yet they have to go through a whole bunch of hoops. And I know right now that with what we're hearing at the Child Care Aware call center, where families are looking for options for childcare, that there are many, many caregivers that just refuse to go through those hoops. So they're not accessing really necessary support, because even though $2.65 an hour sounds very little, it could mean the difference for a family childcare or a family friend and neighbor caregiver being able to pay the water bill or groceries for the child while they're there. So that's part of it. And then also I just wonder too about, more creative thinking. We're getting a lot of calls through our Child Care Aware provider line in King and Pierce County from families, parents especially, that are looking at trying to come up with creative options. And we have to guide them away because they start to get into licensing requirements. So for instance, like coming up with co-ops, and nanny shares, or I'll take the children from 2 or 3 families for several days a week, and everybody chips in for groceries or things like that, where they're not really running it as a business, but they're trying to come up with a solution, especially in the short term.
All right, thank you very much for sharing that, Lisa. So if we can move to question number 3.
Okay, I'm ready. What has been your experience with licensing and or engagement? So in the beginning, our licensor came in March and actually braved the elements and sat in our office. She socially distanced, but she sat there and she was very, very sweet. Asked if there was anything that she could do to help. We talked about what sites might close, not close permanently, but close while we were cleaning. She was very open to say if there's any waivers that you need, contact me. We will help you if you need to change age groups or anything like that. We have a large enough facility and multiple sites that we didn't need to do that. But that was the extent of our engagement. What I think would have been helpful would have been some checking back in to find out what we've done, because I think a lot of the providers are actually creating our own systems. We had to do it for ourselves. And so I think you all need to listen to us. What did we do well during COVID? Why are we COVID free? How do we keep ourselves safe? What did we do? What do our facilities look like? How do we space tables? How do we do things? So I think you all are going to have to learn from us, because we didn't get any direction as to what to do from you. That's me.
All right, thank you very much. And I would, I know I didn't respond to the other question, but I would echo what Angie just said about having the need to create our own systems. And I also want to share in what went well very briefly is, it would be lovely if there was a way that we could clone Travis and his enthusiasm and respect for as well as his support in helping licensors down the chain, because I can say that that has been the experience that I've had, as well as other peers that I have in working with licensors and that type of thing. So on that note, I'm going to move on back to Lisa. If you would respond to question number 3, please.
Yeah, and in this one, I mean, I'll take off my family, friend, and neighbor care hat and just represent what I've heard from my coworkers at Child Care Resources who've been dealing with and helping licensed child care providers navigate COVID. I would say, I would totally echo what Angie is saying, is that there was a lack of guidance around how to address concerns around COVID prevention. How does that impact the delivery of childcare? And I think too, somebody else had mentioned too, a couple people, about the lack of supplies and things like that. And I would say that the support for providers that has come in terms of like supplies, PPE, that has all come from the local level. So I know in our region in King and Pierce, it's been King County's, City of Seattle, Pierce County, Tacoma, City of Tacoma, and private money that has been invested in getting bleach and face masks and all sorts of things out to providers.
All right, thank you, Lisa. Mary?
Licensing has been, I would say, challenging, the licensing experience for many family child care providers. And I will also say that I serve as the president of Family Child Care SEIU 925, our chapter. But the concerns that I continue to receive from providers is that because there's licensing tends to be punitive always with certain providers. And so with that being said, as opposed to having the levels of steps of investigation, even though the licensors aren't quote unquote able to go out, but they are able to close down. So without the proper steps of investigation. So again, you're dealing with many of the providers, they call them the quote unquote the rogue licensors. We don't always get the Travis. I've been fortunate that I've had some amazing licensors, but many of the people that I sit amongst, they have not had that shared experience. So if we don't get to the point where, you know, even though we do the interreliability and they're supposed to be trained in one way, even the messaging going out I was fortunate, the week before COVID, my licensor came out, but many other providers, they didn't have that. So they're even unsure if they're still going to come, if they're going to do this virtual thing, what are they going to do? There's no guidance, so they don't know. So just the unknown, it's hurting.
Thank you, Mary. Luke?
Yeah, so I echo the same, and the relationship for me personally has been really good. Like I said, we can call Travis, we could call Judy, even Frank, who's they will respond. They will meet providers pre-COVID and even virtually. And the access has been really good. But like my colleagues are saying, when it comes down to those individual licensors, you know, it does look like the Western punitive system that I don't know how many studies need to come out to debunk this strategy and whether it works or not, because we know it does not, right? So this is why I think it's very important to look back into the licensing process, the licensing review process, and making sure centers and child cares in general are able to be part of that, because that will help those individual child cares know that they have rights, right? They're already in survival mode, and like the previous colleagues have stated, they feel isolated, especially right now. And there hasn't been a lot of guidance. And like Maxie said, hey, what we do is we go and we figure it out. That's what we've always been doing, but that's not best practice, right? So I do think DCYF needs to understand we are intelligent, we matter, and we know what we're doing. So don't look at us like a big brother looks at his little brother, or don't look at us like these systems typically look at us, especially us people of color. And look at us for the smart, intelligent people that we are, that have solutions that will help you guys out, right? Like we're trying to help you help us. So it really needs to be on that level. And I definitely think looking at that review process would be very beneficial. And then looking at how resources are shared. So as providers are letting you know, hey, this is what we're doing, this is what works, being able to share that with the provider network so that we're not feeling so isolated. So yeah, that's at least my answer.
All right, thank you very much, Luke. Yeah, you mentioned sometimes the way licensors view providers in a paternalistic nature can be challenging, especially when you look at people with a breadth of experience as well as degrees in early childhood education, or even the length of time that a number of providers have actually managed to keep their small businesses going when so many fail within the first 7 years. You have the longevity of experience on this panel, which gives certain credence to the know-how that everybody brings to this work. So we're going to go on to question number 4 now.
Lois, can I add something really quick?
Really quick.
I apologize. This goes to the legislators that are on here too. Like, having trust that we know what we're doing. All we need is you guys to help us get the resources so we can do it.
Thank you for that, Lou. That was a good addition. Angie, would you go on to question number 4, please?
Okay, sorry, trying to get my mute off. I would like to see this group challenge yourselves as well as the governor to look at a way, and I think we're all saying the same thing, and sort of like what Luke was saying, I'm not sure who was representing for us in these meetings that Travis was talking about, Tyler and Travis, but I know I wasn't. So, and I'm 51 years old of Tiny Tots. So finding a way to make sure that there's really an opportunity for all of us to have our voices heard. And I love the fact that you're saying you're going to look at these waivers and lump them and say, man, if there's all these waivers, maybe we need to look at that. But I think we could do this ahead of time. I think we already know some of these things and these standards are not going to, they're going to cause us problems. So if you could allow us to tell you that now, we don't have to wait for the waiver. We can tell you that some of these are going to cause us a problem. And we need to have a way to be able to easily shift and allow providers to keep doing their job without feeling like it's punitive. So if there's a way for that, that's what I would ask to be added into legislation or rules or whatever you call them.
So then, Angie, I want to make sure that we're clear. So if you think about the one issue solution change you would like for
I would like, I'm gonna tell you right now, you're gonna get a bunch of waivers around the 5 years. So we already know that's a problem. Why wait and allow people to keep giving you, I want a waiver, I want a waiver, I want a waiver for 5 years. We already know. If you ask us providers, we will tell you 5 years is not long enough. So you need to, there's things like that. I think we could already tell you that there's going to be a group, upswell of this is not going to work. And it's going to frustrate you all instead of just allowing us to bring it to you early. Instead of you having to wait for the waiver, let's address it now. Because the 5-year, you're going to get a bunch of waivers.
Okay. So being able to tackle those standards that providers see as problematic early on to avoid having to request so many waivers and variances.
Yeah, and one more thing quickly,
Okay.
and I know I'm over. One
Sure.
more thing quickly.
No, you're fine, Angie.
Okay. What, I was on another panel with Luke, and we were saying in the very beginning when COVID shut down, they didn't care if USDA, we were serving hot dogs, chicken wings. They didn't care. They didn't care in your classroom what you were doing. Just keep some kids and feed them some food. Now, we all knew better. So we were like, no, we're going to do good quality things. But if you got to go back to itters and eckers and all that, I have a real problem with those standards. And I think after COVID, we need to talk, because we're not ever going to have pillows and stuffed animals and wood corners and none of that stuff. That's going to cause germs, ever. So if that's in itters and eckers and all that, we're going to be scoring low. And I think that's unfair. We need to go back and review those for COVID. Okay, I'm done.
Well, thank you. That is because if you look at the fact that they just announced yesterday that the vaccine probably will not be available to everyone until sometime next year, that is definitely going to change how providers are able to meet the standards that Early Achievers puts forth if we're still using those same tools without a big change to that program. So with that, we'll move on to Lisa. Would you address number 4, please?
Sure. Yeah, thank you. This is where I get to do the plug on including family, friend, and neighbor caregivers in the early learning plans for our state, and doing so in a way that is based on best practices. And this is outside of the Working Connection subsidy program, since we know that so many children are in the care of family, friend, and neighbor caregivers. Really, the best ways to support them are very akin to the way that we provide parental and family support. So it's through things that happen in local communities that bring caregivers together, that link them to trusted advisors. So things like facilitated play groups, include them in home visiting programs, imprimatores, and other sorts of systems navigation support. So we need to make an investment in and really start making a concerted investment in this. And I think it's really, really important to note that the pandemic, as we know, laid bare a lot of the racial inequities in our systems, and what we saw as schools and school-related early learning programs closed, the people and organizations programs that still stood standing with families were centers that were primarily based in communities of color and run by Black, Indigenous, people of color organizations, family child care providers, and we all know that many of those folks are women of color, and then community-based programs that are grassroots run by and for Black, Indigenous, people of color. And they were the first responders out there helping family, friend, and neighbor caregivers and families deal with the crisis and getting them the kind of information and support they needed.
Thank you, Lisa. So more intentional FFN support and investment in that area. Thank you very much. Mary?
It's challenging for me because in my head, I'm sitting up here going, this is a simplistic problem that we have so many systems that are blocking things that need to happen. If you were to ask me that question, you're saying, what is the issues? I'm saying, if we are the foundation of the economy, then why haven't we taken the time to streamline services, to invest properly, so that the providers can support the community? We can't support the community without supporting the ones who are supporting the community. I'm sitting. It's not jigsaw puzzle for where we sit. because we see it and live it every day. I'm just asking for the legislation to say, you know what, this doesn't require, you don't need a law to be compassionate. You don't need a law to be, you know what I mean? We need people to understand, okay, this is what we're doing. Let us do it, and let us do it well with your support.
So Mary, if you were thinking about the report and what needs to be included specifically that you would like for the oversight board to do, how would you frame that for me?
I would word it to, they have to be willing to support the foundation of our community, which is the early learning community. And in a way that it's not stuck to the politics of the governing class. It has to understand that it's not a new entity. Early learning providers have been here. Now you're saying you see us. Great. See us, see the work that is being done, and support those efforts.
If I could add on, I think what you are saying is just like they respect K-12, and it's automatically decided that there's an automatic budget for them, and they just knew they weren't coming back. They didn't care. They were not coming back to that classroom. They was not. And they still gonna get their budget allocation. So we need that same level of respect, because we're here and we're still juggling, figuring out how are they gonna pay us, not pay us? Are we gonna get it? That's not fair. That level of instability is not fair, and we're the foundation. Excellent point, Mary.
Okay, so then I think I want to make sure, so that's ensuring that our funding stream is consistent and doesn't change all the time, so that we have that same level of funding for families that are currently accepting or in the grant program, the same way that they would through OSPI. Is that?
Yeah, and especially during the pandemic, we're in a war against a virus. We're in a war against a virus. Treat it as such. Treat us as though we're in a real war with a virus. You need these providers. We got to support them. Let's do this.
All right, so Luke, I'm gonna move on to you because I want us to still have time to have questions, which is, and we moved, even though everything we've shared is so important, but I do want to have time for the oversight board to ask questions. So Luke, if you would succinctly go into number 4, and then we'll open up for a Q&A.
Yeah, this one honestly was very difficult. And even the answer that I'm gonna give you right now, might still need some more. But if we're really about systematic and racial change, then we need to do a better job of representation within organizations, especially DCYF, and ensure that there's more opportunities where people of color feel like they have actual voice and autonomy, especially around professional development and how that's laid out. Okay, so if we're really looking at our systems, that's one thing that I would point to. Again, I would point to the licensing review committee, looking at who's on there, how that process is being done, and to kind of take more of a paired out approach. Guys, we have the collaborative task force. We had the AWB came out with a report about childcare. We've had the compensation technical work group. How many groups do we need to see to show that we need to figure out a way to compensate the workforce and to make sure that the workforce gets health care? That might be out of the scope of the oversight group, but I know everybody that's on this call has influence, and we really need to see those things be done. But I do want to say before I pass it back off, Lois, I don't say all this stuff to be discouraging, because I know this is a thankless field with early learning as providers, and also everybody else that's associated with it. And I think it's because it's that important, right? And there's always work to do. So I think if we stick together, and if we make sure that we're continuing improvement and giving provider voice, we'll get there.
Thank you for that, Luke. You know, DCYF held a webinar to be able to connect providers or center owners, whoever participated, to the health exchange, which was very helpful. But with the caveat and thinking about compensation, in order to really be able to receive ample health care, which is great for those who don't have insurance right now, it's better than nothing. There, of course, are income limitations to who has access to that type of free care. And that then compresses a person's wage. It's like, if I make more than X amount of dollars, then I will no longer be able to afford health insurance. So it's a nice short-term fix, but it's, and going with what you said, Luke, it's, we need more adaptive and innovative type of healthcare benefits available for this field. So I'm excited to move forward with that work that I know DCYF has started in conjunction with some providers. So on that note, my peers on the Oversight Board, we're going to open it up to Q&A, and we have about 15 minutes, which is more than what we normally have, which is great. So if you want to direct your questions to the panel directly to anyone, or if you want to just see who answers first, we'll move forward from there.
I have a question for the panel. So we heard in the presentation from DCYF that they have really shifted from a see it, cite it mentality with licensing infractions or violations to technical assistance, come alongside you, help you correct it, assume that you have good intent of following the WACs. And I am just curious what your experiences have been. Is that culture change something you see in your everyday practice and engagement with your licensor, or has that not trickled down to your experience?
So again, it depends on your licensor. And at Tiny Tots, we definitely have that. Our licensor is, she's like a team member, cheerleader. If there is a area of concern, we work on it together. But that's this particular licensor. So it to me, it depends on who your licensor is.
Yeah, and I'd echo the same. So from the top, looking at Travis and Judy, look, you could tell that they are really pushing for a shift in licensing that we had seen prior to about 5 years ago. And but there's still work to be done. And I think the best way to solve that is also that, again, I keep going back to looking at the internal review process and who's on there, because mind you, there's a lot of providers too that don't know their rights and they're afraid to speak up. Or if they feel like they speak up, you're having DCYF kind of determine what that rule is, cite it, and then be the judge of it, right? So that internal review process where other owners of childcares can be there as well gives providers a spot to open up and be honest, because there is a just take it mentality that we really need to shift. And I will add before I turn it back, look, so DCYF, especially licensing, talks about safety of kids. Now, come to Parkview, okay? Look, I have more consideration when it comes to my parents and keeping them happy and making sure that they are bringing their kids. That's really who my oversight is those parents. And if I'm doing a great job. So this notion that we need a third party to essentially ensure the same thing, you can see how that's a little, what's the word I'm looking for? it's kind of looking down on us like we don't know what we're doing. Look,
Top down. It's too top down.
Yeah, exactly. And so we need to transition that. And I think that review board will really help.
All right, thank you guys for that. Anybody else? Any other questions from the Oversight Board?
So this is Diane. I am a developmental pediatrician, and I was wondering about the mental health concerns that you may have for your providers, and what you think we or the state could be doing to support the providers during this really challenging time for not just childcare providers, but for families and the kids themselves. Do you have any thoughts about what supports you might be able to use?
I don't want to monopolize the time, but
Me either, Luke. Well, you go ahead.
Well, as you know, mental health is huge, right? We especially, and I'll speak to my own personal experience at Parkview. We're serving families furthest from opportunity and kids furthest from opportunity who have a lot of adverse childhood experiences, but we're not getting access to the services that these kids need prior to going into kindergarten. So if we're talking about kids being ready, the kids need to be social emotionally ready, and they need to have the supports, right? So that we're not spending as much money that we're spending in the K through 12 system for things that we could have solved earlier. And then mind you, my staff, they're going through COVID as well, and they're coming in every single day to serve these same families and kids that are either kicking them, punching them, and that has a toll mentally, right? So that is another reason why we bring up the healthcare pieces, having access to mental health. And mental health looks different, right? So to me, it might look like going to a therapist and being able to talk to the therapist. To other groups, it looks differently. So having that flexibility when it comes to mental health, I think is right under healthcare would be my number 2 for staff and also for the families that we serve. And right now we don't have access to it. The school districts, we've been trying to work with them, trying to get access to what our taxpayer money goes to for them to be able to have those services, whether it's through telehealth or somebody coming in, and we're not seeing that. So we definitely need everybody, I think, in this call to push for those matches to be made with providers.
And Diane, I think having free trainings available for providers on how they can support themselves as well as family members in mental health would be impactful for the field. The stress of trying to keep our doors open, that's important. I know, Angie, if it's all right with you, Mary, do you have anything you want to add? And then we'll go back to Angie.
On the onset of COVID, I brought this up to the union as well as to licensing about the mental health of the provider, as well as the mental health of the families that were coming through our doors. So, and the isolation. And unfortunately, it only met with, there was no funding, I was told repeatedly. That there was no funding, there's no funding. And then they said, okay, we can do a pilot possibly through the Imagine for just King County or just to the city of Seattle. And it was like, our provider, I brought this up and I felt like I was beating a horse because no one was hearing that. I'm saying, look, there needs to be help for the providers that are dealing with COVID since they chose to stay open to help the community.
I just want to say, I lost 2 staff that couldn't do it. They were with me in April, but by August, they mentally just are checked out. So I respect them, and I told they've worked with me for over 6 years. But I told them I respect them, and their health is more important, and that if they just can't do it, they can't do it. The remainder of my staff, what we've tried to do is we close on Fridays, and that's called our mental health day on purpose. We named it that. I want them to think about their health. I want them to think about their own families. I want them to clean their own house. I want them to take care of themselves on Friday. And I pay them. I pay them for that because I feel I have to in this war on COVID, that I can't expect them to be the best they are Monday through Thursday, taking a risk every minute that they could get COVID and wiping out all of their medical. If they got to stay out for 14 days, who's paying them that? You know, if they got to close in another 14 days, where's that coming from? So we decided early on as a group that we take our vacations together. So, and my parents have been going along with it, and we appreciate it. Since April, we have all of us, because I don't have time for somebody to take 2 days off, somebody take 2 days off. We all agree we take 1 week off together. We come back, we work real hard. 2 months later, we take 1 week off together. And that's what we've been doing to try to keep ourselves sane. Again, nobody told us this. We're just trying to figure out how to do what we need to do to stay healthy, stay functional, and keep them sane.
And to continue to provide the quality outcomes that you have always done for the family and for our children. You know, you talk about thanking people for their service. Definitely due to this panel. Lisa, do you have anything to add? If not, we're going to see if there are any more questions. And Krista did let me know we can have a little bit more time. There's only one person signed up right now for public comment. So that gives us a little bit more time to continue our Zoom side chat.
Yeah, Lois, I mean, mental health and support has been on our minds too with family, friend, and neighbor caregivers. And Child Care Resources runs the Kaleidoscope Play and Learn groups across the state of Washington. And we're involved with community-based organizations that actually run the groups. And we've been in contact with facilitators about the kinds of concerns that families are bringing up and caregivers are bringing up, and stress. That's the way it gets labeled. The stress of being isolated and the stress of being at home and not being able to be in community with others has been like one of the #1 concerns that have come up. And I only anticipate that is going to continue, if not grow, as the economic impacts and the compounding impact of, you know, more isolation upon isolation happens. So I think, again, it's continuing investments, starting some investments in supporting those families and caregivers that are outside of licensing and regulation that are currently not supported right now is really important. And I will say, even though like Play and Learn groups typically meet in person, they have still been in service to families. And some of them are doing virtual gatherings. Many of the facilitators, again, have been sort of like that first line responder of really helping families connect, caregivers connect with the latest public health advisories, of getting them connected with basic needs, of making sure they're housed and fed, and then connecting them with whatever services are available. So I think it's really, really important. Mental health definitely has to be on the agenda.
All right, thank you very much. We have time for well, if we can sneak it in, Luke, we're gonna have a little bit of time to summarize, but I just want to see if there's just one, if we have time for one more question. And if no one has anything, then I will turn it back over to you, Luke. Well, I would sing the Jeopardy music, but does anyone else have any additional questions?
I have a question. What are the demographics of the department that is in the license unit? If we could get that information back, what does that demographic look like? As Luke was saying, I'm curious too. Men, women, diversity, color. I would like to know who sits on that department and how diverse does that look like? And who are the power players and what do they look like? And that's,
Well, you know what?
you can get back to, Lois, they can get back to you on that and you can share that with us. Thank you.
Well, one of the good things about the Oversight Board is that it's always open to the public and questions and things like that. There are follow-up responses. So, you know, it's open to the public. So maybe plan everyone to come next month too and hear the answer to that question.
So Lois, thank you so much for facilitating this and for the really very insightful comments of the members of the panel. I think this has really been instructive, and I also would like to thank Travis and Tyler for their presentation. The department clearly is working to be more responsive to childcare providers and to consult with them, but there is more work to be done. So we are at public comment. So I would like to go ahead with that, and then we will have a 5-minute break. So Lois, thank you very much.
Oh, you're very welcome, Ruth. And Luke, you have a chance to make your comment during public comment. So,
well, if Luke has a further comment, he can go ahead and make that. Luke?
The only thing that I was going to say, and I'm glad to see you, Ruth, on here. The only thing that I'll need to say is, look, we have had legislators like Ruth who've been working on early learning for how many years, right? And we've had so much work being done recently with legislators from both sides of the aisle. Let's not reinvent things, right? All of these recommendations that we were talking about, they're on the collaborative task force recommendations. There are, like I said, in the compensation technical work group, you can find them there. We already have the answers. We just need to stick together and make sure it happens. We need to make sure that we're compensating the field. We need to look at the rules that are barriers that really don't do anything to ensure child safety, and make sure that we remove those barriers, but we need to do that together. Right now is go time. It's no time to play Republican or Democrat or this or that. We need to band together as Washington State and just keep pushing forward and do those bold investments and changes and rules that will really help our kids in our state.
Okay, thank you very much, Luke. All right, with that, I would like to turn this over to Nicholas to call on anyone who signed up for public comment.
Great, thank you, Ruth. So first up for public comment, we have Jim Theophilus. So go ahead and unmute yourself.
Hi, everyone. Thank you very much for this opportunity. I wasn't going to speak much today because early learning and childcare, although I care a lot about it, I don't pretend to have any expertise in it at all. But I just have to start by saying thank you to Lois and that panel. It was truly so inspiring and so powerful, and kind of reminds me as how even foster parents have talked about themselves as being first responders. Like, these are the folks who know which children are in trouble. These are the folks that are doing overtime to keep kids and families safe. So I just was so touched. But I also have to say, it was interesting to me how many common themes there are between the providers that we just heard from and caregivers, foster parents, group home providers, et cetera, in terms of the licensing issues, the compensation issues, the retaliation for speaking up. So I just really, as we think about the Oversight Committee and the hope and promise of this new department, I think there's really some key takeaways around how these common issues are impacting folks, no matter what system or at what developmental stage people might be helping kids. But again, I was struck by the passion, the compassion, the creativity that certainly Mike sees through FPAWS and that we heard in this panel. And again, one of my, as the kids say, Jimisms is how do we make sure we're taking good care of the folks who take good care of kids? And that's more than a brochure one-liner. That really is a fundamental principle around how to organize a system. And so the licensing really struck me. And I want to say I have deep empathy for the licensors, because they do have the whole continuum between what are the technical issues they need to be attended to. Like, yeah, here's a great provider and they got their paperwork in late. How do we help them get that done rather than making that a thing? All the way along the continuum to, wow, there's some safety issues that we really need to lean in on and pay attention. And I've been around long enough to know that no one may notice that, but as soon as a child is hurt, and it's on the front page, then everybody's going after that licensor or that case manager. So I get that the stakes are high, but it does seem to me that the licensing area could be a place that the oversight committee could really lean in on, because I appreciated the one question about what are the demographics around kind of the power structure. I would say that the licensing, to make sure we're really clear on the demographics around who's being invested, both in foster care as child welfare, as well as child care. But I think that could be instructive if we really make sure we've got some dashboards around who really is getting the most complaints against them. What do those complaints look like? How are licensors responding? And is it heavy-handed and top-down, or are they really intervening? But when we talk about, and I just really mean this so much, and I see Senator Darnell and Representative Kagi and so many others, Representative Sen, who I know care so much about the change we made by bringing early learning, juvenile justice, and child welfare together. And I still feel committed to bringing that hope and promise alive. And here we have, again, how do we make sure that them children that are in these amazing providers, child care center, are not ending up in juvenile justice or in foster care? So what I remember when we talked about that is we were going to provide the kind of support all children need to thrive when they're in early learning, so they don't end up in juvenile justice and foster care. So again, I just really think that we might really look at how could the Oversight Committee take on the licensing piece, because I think it's got a lot of work for sure, but it may be where we can have the most impact of making sure that those providers who are doing overtime are being treated fairly. If there is a complaint or something that happened, how are we really setting up a system that supports them and knows that our licensing and our corrective action sort of approaches are handled in the best interest of child safety and not turning into retaliation or other kinds of issues? And so the other issue that I'll touch on real quickly and then leave you all alone is this oversight, and what is the role of the Oversight Committee? And I guess for me, my vote is let's be as in the weeds as we can. And I know that's not a popular sort of phrase. We usually want to say we're staying out of the weeds. But I don't think any of us thought that we would create a whole new culture, a whole new integrated system in 1 or 2 or 3 years. I think this really is where many of you will be handing the baton off to other folks. And this has nothing to do with the current staff or personalities who are serving in early learning or child welfare or anywhere in DCYF. It's really about, and I borrow this from our Native American brethren, where I learned a long time ago that one of the ways to look at big change is to think 7 generations ahead. Like, what's the impact we want, not just today when you all are on this committee, but what do we want for you to visit 5 years and 10 years from now? And so I'll close by just saying, I really encourage you to make it okay to be an oversight committee with a capital O. And secondly, to really consider this licensing area as a place where you might really make sure that we have equity, that we have good care for children and families, and that the department really is partnering and listening to those who take good care of kids.
Thank you very much, Jim.
Thank you for the time.
Next, Erica Halleck would like to speak.
Thank you, former Representative Kagi. Erica Halleck on behalf of the Family Impact Network and the Ounce Washington. And I'll just be brief. Thank you, Lois. That was a really wonderful conversation that you facilitated. Very, very informative. And I just want to commend Krista and the chairs and all who have put together these rich conversations that you've been having, particularly in the last few months. And I think about how if there's a way to amplify these conversations and that more people can hear them, because I think they're quite informative and they're long enough that you're able to really ask good questions and get to some real issues and some potential both administrative needs as well as potential policy changes. So that's just a recommendation. I'm not sure what the answer is, and maybe those of us in the field can do a better job of talking about this with our colleagues and getting that information out there. So I just want to commend bringing in people that are doing this important work every single day in all the areas of child welfare, early learning, and juvenile justice. So I just hope more people can hear about it. So thank you.
Thank you very much, Erica. And it's a good note to leave and go on a break briefly, but I just think you are absolutely on target, that hearing from providers in every area that the department serves really provides insight and inspiration and appreciation for the tremendous work that the providers are doing in the field taking care of our kids. So thank you, and we will take a 5-minute break. So let's plan to be back here about 12:26. Okay, talk to you in 5 minutes.
Thanks all.
Thank you, panel.
Well, I think we will go ahead and begin our Q&A from board members to Travis and Tyler, who I believe are still with us, are they not? There they are. Good. Okay, well, one of the questions that I have, I will start, is the question that has been brought up several times about the review board. And what exactly, who is on that, and how often do they meet? Can you just tell us a little bit more about that internal review board? Because I don't believe the Oversight Board has provided names of providers to sit on that board.
Yeah, I can start, and then Tyler, you can add in more of the logistics, kind of legal stuff with it. But so one reason is that we haven't gotten anything to that level to review. So when nothing has escalated to that point. So basically what has happened is things have been turned over at lower levels, or people didn't choose to go to that level is what's happened. So in some regards, what it's saying is the process that we have in place is working because providers are getting the answers that they need, or understanding the WAC better, and then not escalating it is what has happened. And that's why we haven't had the situation to use it. Now, I think that with the rewrite, it's going to fix it and allow providers to use it more and make it easier for them to use it. So it's really a technical thing that something had to be, a compliance agreement had to be on the FLICA. So there had to be an issue that went to the FLICA, and in lieu of a FLICA, we took licensing action, and it got really, really clunky. And I know that this is not making that much sense, but it's a clunky, and that's why we're doing the rewrite, to fix it, to streamline it, to make it easier for providers to get to that level without us getting to the point of taking an enforcement action. It is what it is. And Tyler, if you want to clean up what I just said, go ahead.
All right, I was on double mute. Can you hear me now?
Yes.
Yes. Okay, thank you. Yes, what Travis said is accurate. Boiled down simply, the internal review board, or the internal review process, is created in statute that was written into the bill that created DCYF. And this board has certain duties and certain responsibilities, and those are all written into statute. So they're not in WAC, they were created by the legislature. And if you want a specific citation, you can look at RCW 43216395. I just side note, I am a licensed attorney, so I love jumping into the weeds here. So I really appreciated Jim's comment earlier, because here we are. So the internal review board, or the internal review process, is staffed by 6 individuals, 3 of which are DCYF licensors, and 3 of which are childcare providers. Those childcare providers are put forward by this board. The oversight board puts forward either those individuals or a list of names to pull those individuals from. And Travis is exactly right. The system and this process is new, and nothing yet has risen to this level for the IRB to review. And that is partly because there was a technical kind of a catch-22 written into the law. It dealt specifically with the definition of a FLICA, or the Facility Licensing Compliance Agreement, that essentially prohibited the IRB from reviewing what the IRB was supposed to review in the spirit of the law. So what our bill does is it fixes that technicality, it streamlines that process, and it makes it more clear that a provider can dispute or appeal a violation internally to DCYF, and then if they want to, they can go a step further to the IRB. And again, those are disputes that do not impact their due process rights, any due process right appeals have to go outside of the agency to the Office of Administrative Hearings, where ALJs can adjudicate those. Like I said, we're in the weeds. I hope that made things slightly more clear.
Very helpful. So I assume then the IRB has not been constituted yet. So
correct.
The Oversight Board should provide 3 names to you so that the Oversight Board or the IRB can be convened if needed.
Correct. And just so you're aware of how we're planning on spinning this up is the IRB is going to be created on an as-needed basis rather than a forever standing committee of 6 people. So anytime one of these issues does rise to be reviewed by the IRB, at that point, if this board would like to do it this way, at that time, we would get names of people who are available to look over that issue at that moment.
Okay, that's very helpful to have that clarification.
Wouldn't you need a lot of training of an IRB person to have it as ad hoc? Seems like, how would they know? Like, seems like there would be a lot of training that would be necessary versus just having ad hoc 6 people.
It's actually, we ran a pilot and we actually brought in providers. And the interesting thing is providers are the experts on the whack. I mean, they knew it better and were actually harder. We took examples of old soup reviews and they reviewed them, and they were actually harder on the provider than the licensors that were sitting in the room, which was very interesting, because what you had providers that do this every single day go, no, they need to be in compliance with that. And this is how I do it. And so it was actually really great feedback to us, because the providers were like the ones that kind of pushed for this in that pilot that we ran. So actually, they're already trained. We just need the providers to be able to be on the group. And I actually think it'll be easier now, because from a logistics point of view, before COVID, we were worried about how to get people together, how to get documents. Well, now we're forced to be in a meeting like this that would typically be in person. So it's actually easier to do it now that we have access to Zoom and sharing documents over Zoom and that stuff. So I think we'll be able to do it fairly reasonable, fairly easy.
And if I can, I was one of the providers that were part of that group, and what Travis is saying is true, because there were some things that we just, weren't willing to compromise, because there are ways to do it. I think that what we did come out of that meeting is that how can we find ways to disseminate some of this information more to providers, so we can have more shared resources, even if it's documents and how you. I mean, I'm really going into the weeds here, but refrigerator logs, let's just say, little things like that, to be able to have access for everyone, was something that came out of that review pilot. But everyone, to answer your question, Ruth, came there, and it was a group of providers and licensors from around the state. And it went really well. And at the end of it, left with a clear understanding that this can work, and it would be very beneficial. And I think the key would be, and I'm sure Travis or Tyler will address this, is just simply letting providers know that the IRB exists and that they do have another group that they can go to if they don't receive a satisfactory answer to what they're appealing.
Okay. All right, thank you.
A little concerned that too, with follow up with Rep. Sen there, that it's an ad hoc. That wasn't the intent of the legislation when we did that, and I would like to review that. But perhaps I would like to recommend that we maybe talk this over again at our next meeting when I have a chance to look at the legislation and see that we're headed down the road that we want to go down. This was probably the most important part of this piece of legislation to me, and I worked hard on this, and it meant a lot to many of the members in my caucus that we do this. So I would like to, if that would work for you folks, I'd like to kind of bring this up after I have a chance to review the legislation and my notes that I don't have here with me.
And if I can add to the Oversight Board, just for If we do submit names, whatever the names may be, even if the board is not one that has to meet often, which would be nice if it didn't have to. But if we present the names and maybe have those 3 names serve for a year or for a set period of time, and then maybe have 3 other providers so that we have the opportunity to have different perspectives from around the state, I think that would be very helpful, as opposed to having to submit 3 new names each time, which could delay the process.
I also, Annie would like to ask a question.
Thank you. I think first it's just, I'm wondering, one of the gentlemen who was presenting brought up a collaborative task force report that had a list of recommendations. And I'm wondering if that's something that we could all get a copy of to see what they're thinking, because I agree we don't need to reinvent the wheel. And in the same spirit as that, for the gentleman here from the child care division, I know that DCYF in the foster care space is doing WAC reviews. Oh, I'm sorry. My photobombing friend is barking. For group care facilities. And I'm wondering how much shared learning is going on between child care and early learning and foster care, in terms of the process that you had and how to smooth that out, so that we can learn some lessons from that part. And I'm gonna stop right there because she's not gonna stop, so.
I think, Ruth, you're on mute.
Thank you.
You're welcome.
I just wanted to respond to Annie's comment about the Child Care Collaborative Task Force. Representative Sen and Representative Dent and Luke and Lois and myself and probably others I'm missing are all on that task force. And it is really a very informative report. So it's definitely something that we can forward to the board members. Okay.
I can speak to it, and with the foster care licensing and child care licensing, actually when when they were putting DCYF together, one of the things is that they put the 2 together, because there are things that we can share back and forth, and we actually share the same policy group. And so there is a lot of collaboration back and forth with foster care and child care licensing, because it's very similar, but different at the same time. So there is a lot of things that we're sharing, and we're both in different spots, right? With where we're at with our kind of the models that we're using. But yes, we are collaborating together.
And does that involve, again, consulting with providers, both foster parents and child care providers?
Yes, it does. Yeah. I go back to that, the negotiated rulemaking, just listening to providers is huge. And I think we're still trying to figure out how to get that. I mean, I learned a ton today just listening to providers talk, and, we need to keep that lines of communication open and hear what they're saying, because they really are the ones that are doing the hard work day to day. So, yes.
Okay, anyone else? Does anyone have a question?
Yeah, I do have a question, and I apologize if this was asked. I popped back up a little bit late, but I think to one of the panelists' point about looking at current standards and situations that might have changed given COVID, like a requirement for, blankets or, a wood block that maybe now is harder to clean than a plastic block or something. Are there, have you guys reviewed any rules, or do you have a process to do that that has a COVID lens that might bring up changes that you are looking to make or have particular flexibility on?
Yeah, we don't have anything in place right now. What we do have is a really good system that tracks and gives us some data points that we'll be able to look at as we get that data. We just don't have enough data, and we don't have enough data definitely with what COVID and things. I mean, I think that's one more reason to listen to providers and hear. I mean, it was great to hear how, you know, they've figured out how to do this, and you know, that needs to be shared to other providers to support them, to give them ideas. But we don't have anything in place right now. We know that that's what we're trying to put in place, of how we start rolling back into the new normal as you know, as COVID runs its course. You know, we're definitely going to be looking at how we do our jobs differently, definitely looking at, you know, is there rewrites of the WAC that need to be changed? Did we miss something? You know, those things, those discussions are going to take place.
Well, recognizing that licensing and quality improvement are two different systems. Reference was made a couple of times in this discussion about ECHRs, and there were, you know, how COVID does not fit with ECHRs. Is licensing and the early achievers staff, are you working together to try to assure that our quality standards and our licensing standards are in sync, and that we're not grading people down on things that they've done to protect their children and staff?
Yeah, we're having those conversations, and that it's one reason why, you know, really the rating system has been put on hold right now with COVID, and they're not doing rating right now because, you know, the impact that it could have, because folks are trying to follow the recommendations of DOH. And so, you know, it is putting them, you know, it's like, it's the whole thing that we've been fighting with licensing. Do you follow early achievers or do you follow licensing? And we fixed all that. And then COVID came up, and it's like, do you follow DOH or do you follow early achievers? You know, obviously in a pandemic, we're going to follow the recommendations of DOH. So that's the guidelines, or the guidance that we're giving.
Okay, thank you.
And if I could chime in quickly, one extra note is that we, through our outdoor preschool pilot, found that outdoor programming met that need. DOH recommendations for social distancing, for smaller group sizes, for outdoor exposure and ventilation met DOH and was able to meet high quality standards. So that was a pretty cool COVID reality that we learned through that pilot project.
So I'm just curious, with all the unhealthy air that, I mean, I know we're all staying inside, what are outdoor preschools doing to deal with the smoke epidemic?
That was, they would be closing then, because it's not safe to be outside. That's one area that, you know, that they would run into that. So yeah, until the air clears up.
All right, are there any other questions from board members? Okay, well, we really can't thank you enough, Travis and Tyler, for being so open to questions and to really learning from providers.
Can I add one more thing that just to kind of touch on something?
And when you finish, Travis, I did have one question. I was trying to unmute. Go ahead.
This licensors being inconsistent, right? You kind of heard that theme as providers were talking. One thing that we have not gotten to that I think is really important to bring up for you all to know is that our plans were to roll out inter-rater reliability. What we first wanted to do was roll out the new standards and then roll out inter-rater reliability for licensors. And I think that is the true goal, to get consistency across the board with licensors. We've been chasing this consistency thing, and you heard it, well, I have a good licensor, right? And what we want is we want that it's not that you have a good licensor, that licensors treat providers the same way across the board. So if you have a visit in Spokane versus Seattle, that looks the same and feels the same. And it's not caught up with a good licensor, bad licensor. And that really falls on us to do some training of our staff. And because COVID hit, we weren't able to roll out our inter-rater reliability, which would make our licensors reliable, so that when they're looking at the same thing in Spokane as in Seattle, they're addressing it the same way. And we haven't got to that yet. And I really think that's where we have to head. The other thing is what I saw our staff, because they only had a window of 5 months with the new practice of, that assuming compliance, that what we saw is our staff have slipped back to see it cited, especially when we put them in front of a monitor they're trying to see stuff to cite versus assuming compliance. And we have seen our staff slip back, and we're going to have to do some retraining as we come out of COVID. And I think that's important to say, that we're working on that, but we have to get to that inter-rater reliability, which will truly bring consistency across the state with licensors. So I just wanted to mention that.
That's great.
All right, thank you. And then just quickly, for the IRB, when it comes up, it would be interesting. I would love to see what DCYF is planning to do to get that word out to providers that is an option. And then this may be part of the next presentation, but I know Tyler had shared about the family, I believe it was Tyler had shared about the family hub. And I just want to know it just seems to me that the family hub model is simply allowing home providers to function as centers without the same standards. And where you have one licensee that has several, you may end up with 40 children across 7 different places. And I'm just wondering how you plan to handle that. And it just, quite frankly, just doesn't feel right or fair to centers that are have a different set of rules that we have to follow that are more stringent than homes. So I just want to know how the department plans to handle that, as well as what research was done or where the idea came from. Was it a survey that was sent out to family home providers? How was that model put into place, and what feedback came from the field?
I can definitely address the first part of the question, and then I may have to ask you to repeat the second part. Family home model, yes. This is a new idea where we are looking to expand basically the available real estate for a family home licensee to be able to offer family home programming. And the way we are primarily doing that is with removing the residency requirement that's written into the law, that's written into the definition of family daycare provider. So the idea is, if I'm lucky enough and fortunate enough to own 6 houses and they're all my residents, I can run a family home program out of those as the law is currently written. Not a lot of people can own 6 houses, especially in really, really expensive parts of the country like Washington. So by removing that residency requirement, I can now work with other homeowners to set up family home programs at their house without having them take on the same amount of responsibility as me. Well, they still have a high responsibility for health and safety and programming, of course, but they don't have to have the residency requirement that our laws currently require. As far as the standards that they would have to follow, they would still have to follow absolutely everything the same way today under the law. They still have all of the same square footage requirements. They still have the same oversight, education, everything, all of that, it would stay the same. It's simply removing that residency requirement to allow for more people to work together to expand the supply of family homes. And then I might, Lois, if you could repeat the last part of your question, I'd be happy to talk about
So this model, did this come from a request from the field? Because I mean, being at a lot of different tables, and I don't know if Mary is still on or not, but especially in being the president of the Family Home Association, I'd be curious if that was something that they had heard before, or just wondering where this idea came from, as well as, again, it still sounds like one person being licensed, able to have more children spread across different sites, which sounds a lot like a center, but with less rules because you're spread in different places.
So where the idea originated, I would have to check with our government affairs team. On the policy wonk, I worked on the solution, wasn't really aware of where it originated from, so I can get back to you on that. As far as the idea that family home providers have less or fewer or lesser rules, it's the same as every other family home provider, which we feel is an adequate amount of rules to keep kids healthy and safe and high quality through our standards. And obviously there's place to negotiate and work on all of those and make them better. But maybe Travis has more
This
on
just
that.
sounds like a center. So I got a house, but the person that's my other house is my program director now. So I've created a mini center in another house.
In some regards, what it is a business model. So we saw it in Canada, in the Toronto area, is where we saw these family homes that you would have a hub model. And what we have is we have some family home childcare providers that are amazing, right? But they're limited to the 12 capacity, but they're really good at the business aspect of childcare. And then you have some folks that want to take care of kids, but they don't want to do the business aspect of it. This allows them to kind of grow their business and have a business model, especially when we're having difficulty finding facilities for centers, right? Like we can't get these buildings licensed, and if they're going to be licensed, then we're back to the fire marshal issue where we're spending a bunch of money to make these into childcare, where this is an area where we could grow the capacity of quality childcare is what it is. It's a business model. It might not be for everybody, but there are some folks that would see this as an opportunity. The other thing that we've run into is unlicensed care. So we've run into these situations where we had somebody operate one of these and then operate another facility and say that their husband lives there or their daughter lives there, but they're really running the facility. This actually allows them to do it underneath the guidelines of the law versus running unlicensed care. So really it's about growing the capacity of childcare.
Okay, the only other question I would say is, and I'm sorry for speaking out, we have a hub model in Seattle and we're using that language differently. And I would be really careful for us to make sure we don't mix language. City of Seattle has a hub model where child cares work with providers, and we call that a hub.
Yeah.
And so I want to make sure we don't get language, we're going to start creating some language that is not going to mean the same thing. So we need to just be real careful about that. And I would love to talk with you offline to make sure we don't run into that problem, because we're expanding our hub in the city of Seattle. And we call it hub, and it's a provider. Tiny Tots is Voice of Tomorrow. We have a hub, and the Child Care Resources, they have a hub. And what we mean by that is we're like the oversight, and we work with 7 or 8 providers, and we help them go from not being licensed to all the way to be able to contract with the city of Seattle and get subsidy for preschool. So I just want to be careful we don't use the same language and we're not, saying the same thing.
That's a great point.
Thank you for that. Representative Sen, I know we have not really had that conversation that landed in the laps of unless Travis and Tyler have had it with other entities. I think the conversation needs to be expanded to include more providers. But I will say one of the uniqueness of family child care is because it's one thing if the state looks in and say, okay, we're going to make mini centers again. That makes sense. But to have a family provider who's hopping from house to house to house, that's a center. That's not a family home. That the essence of family home is the wholeness of the home. So I do know that, like I said, I go to national conferences and I do understand that other states do that. I don't know what the planning was. I don't know what the back conversation was in making that an entity. So I'm just kind of, I just have questions.
Well, it sounds like we need to get a little bit more info about that. And so maybe we can do that obviously offline in another opportunity with providers and staff. I want to thank everybody for this robust conversation. I want to thank Lois for facilitating the provider panel. I want to respond to Luke Jasmine that you do thankless work. I want to make sure, I'm sure that you have been thanked before, but I want to make sure very publicly that I thank you for all the amazing work that you do. I know that's not enough and it still is a thankless job, but I just want to make sure you all know that we appreciate you and thank you very, very much for all the amazing work that you do for our kiddos and families and businesses and the economy. And I want to thank Travis and Tyler for being here today and all the work that you've done. And Tyler, I just want to let you know, thumbs up to Policy Wonk. I wear that as a badge of honor. So that's, I think, a great term. So appreciate that. And yeah, and we're going to swing into our next topic of the day. But again, thank you everybody for joining us on this childcare licensing conversation. I'm going to turn it over to Krista to help us walk through, as you all know, we do a report each year from the Oversight Board. And last year, it was, you know, we were getting up and running. We were still like the first few meetings were just even creating the board. We didn't have all our positions filled. We were trying to figure out what we were doing. And so our report was a little bit more generated by members and like, hey, what do we think we should do? And topics that had come up. And we know now that we're a little bit more established, we've had some very concrete meetings this year. We've kind of getting into the flow of things. I think our report will probably look a little bit different and be a little bit more aligned with the work that we've done as an oversight board. And so just want to have an opportunity to talk about what we're thinking in terms of the look of the report, the time, not the like aesthetic look, but the content of the report, and some timing of how we might make sure that we finish this on time for the responsibility to turn it to the governor's office before it is released. So with that, I will turn it over to Krista.
Oh, thank you, Nicholas. I was going to say, I was going to pull it up. Thank you for that, Representative Sen. And I just want to echo a lot of what she made comments on. We got some feedback from our last report that there was a lot of content in there, and it wasn't necessarily precise in a manner that could be actionable that DCYF could then take, and then we could monitor and see if there's progress being made on. It's a hard task, I think, for some of the topics that we take on as a board, particularly when we talk about culture change. But I think there's ways that we could be creative in this report to make sure we capture some of that. So what I was thinking for today, actually, Nicholas, do you have the year in review? If not, I can pull it up. I did find, sorry, we're working from being on the state shared drive and not, and who's connected and who's not. So it's taking us a little bit more time to coordinate that. You know, I can pull it up if you don't have it.
And it's in the email that you sent us to, if that helps you.
Here, I'm going to pull this up, Nick, if you don't mind letting me do that.
We're doing a little bit of problem solving, Krista. I've lost the ability to use the chat room, and I don't know if that's been turned off again for some reason, or anyway, I don't know if anybody else is having that problem, but
yeah, we have disabled the chat for these meetings because of public records issues. So it is not available, other than if you want to need to communicate with Krista or Nicholas, they can facilitate communications, but in terms of communicating with the whole board, we're not using the chat function.
I guess I wonder about that, since you can save a chat, just like you can save a recording of the work of the committee. I think it much impinges our ability to share information.
Well, part of the problem we were running into as well was that there was oftentimes that chat was being submitted into the chat box that was not being read out loud, and that's an accessibility issue for the OPMA when we're on a virtual setting. So if we do have meetings where people are calling in and can't read the chat, we need to make sure that everything in chat is read out loud. So if there is continued feedback on that and we want to change that, we can do so. We just need to make sure anything that is submitted in chat, whether from board members or anyone else, would be read out loud so everyone would have access to that information. So it just makes for a little bit clunkier of a flow, but we can consider that feedback. So I hope on the screen, this was in the email that was sent yesterday and the week before. What we did here was just decide to do, as Representative said, really talk about what's going to go in the report to reflect what the board itself has heard from the department, heard from providers, heard from young people, and really align what guidance goes into this report to what we've discussed so far this year. Everyone on the board comes with a lot of expertise and a lot of knowledge and experience from your own fields, and that often wants to come through in the report. But I think to make this a really concrete and effective report, it would be great to just reflect on what the board has done. So here we have a very simplified table of a year in review that helps us get a snapshot, look back at what topics we did discuss in 2020, even though, you know, January and February feels like 3 years ago at this point. It is good to remember that we did have some topics, including hotel stays, that we talked about at the very beginning of the year, even though that was 2019 numbers and not what we recently have heard about with the 2020 numbers. So I just want to give everyone a few minutes to kind of look through this. I was going to go through and add in maybe some takeaways from each meeting that I heard that stood out, but I didn't want to take the extra step too soon. But if everyone takes a few minutes to look through this, we could do a little bit of discussion and fill in some of those takeaways that people remember from the meetings. And then we can look at the report that's as it's currently drafted. And I think for the report for this meeting, is my biggest takeaway is how do we want to format that guidance? And I can pull that up in a minute to show how we did it last year, and then a suggestion of how we might want to do it that might be a little bit more streamlined and help us prioritize some of the guidance based on how many stated outcomes each piece of guidance would address. So I'll give everyone a few minutes to look at the year in review, and then we will discuss. I'm going off some visual cues from those who have their cameras on. How would everyone like to go about this? Should we run through each meeting and just take a quick jot down of what people remember were take homes from those meetings? Would that be an effective use of this time, or do people, I know some of these are months ago as well, so I don't know if it would be helpful to revisit them in a different way, or just move on to the formatting, and we could talk about doing a subcommittee work on this as well.
I think in the draft you did, there are some takeaways from these different meetings that are addressed. So maybe we can just take a look at what you started as a draft.
Sure. So I'll do a quick run through. This should be very similar to our last year's report. I'm trying to make it as big as possible while making it readable. So we used generally the same format as before. Obviously, we want to acknowledge we had a lot more engagement from providers, family members, young people that we want to make sure we acknowledge, as well as DCYF. And then
I'm sorry, Krista, can you talk a little bit louder or closer to the camera? Thank you.
Sorry about that. I think my microphone's buried back here. Let me see if I can. Is that clearer? Is that better?
Better.
Sorry about that. Thank you. So we have the table of contents in here, which we'll get down to just to reflect what our previous formatting was, which was went by each of the state outcomes that's listed within the legislation that created DCYF and the board. If you remember correctly, there's those 8 pieces of guidance that we organized by. So this original draft, I have done the same, and we'll get to what Ruth was mentioning about what current ideas from previous meetings are in there right now. But I just want to call out that we could do that way of organizing that piece differently. In order to be streamlined, I did want to shorten the background section, and we did want to pull out a little bit of where we want to acknowledge DCYF has been responsive to the Oversight Board, and some of that we've seen here where I've bulleted. This comes from that strategic priorities document that we looked at earlier in the year, and where we were able to pull out elements that were clearly in the Oversight Board's report from 2019 that we're seeing show up in the DCYF strategic plan. And then we move on from that piece into acknowledging the events of 2020 and how it's really given us a new lens into the work that the Oversight Board is doing, but also the work that DCYF is doing. And then call out some of our main deliverables so far this year, which we really did have 3 main published deliverables. The call for racial justice statement, our guiding budget principles for the department, and then also the response to the strategic plans. So here in the guidance section, again, we can talk about content and we can talk about formatting. I just want to say that the alternate formatting for the guidance section would be to, instead of doing it by stated outcomes and listing pieces of guidance, that we could flip it and we could do listed guidance and then acknowledge all the different state outcomes that might be touched by that, that piece of guidance. For example, looking at racial justice touches practically all the stated outcomes, and that might be a way to instead of being redundant, could make us more streamlined. But let's focus all the time we have on to some of the content that's in there.
Krista, this is Lois. I'm just thinking maybe one way we can start the report out is including the racial equity statement that we all approved. I think, was it last meeting or meeting before?
So I've referenced it when I talk about 2020 and the work that we have here. I do reference it as a bullet point, and then we have it as an appendix. If there is a different way that people want to do that, we can discuss that. So that's open for discussion from the board members, how they want that presented. But that is listed as the first appendix after reflecting on 2019. Is there discussion about that?
This is Eric Dent. I'd like to just see it put right into the report so people could read it as they read the report. I think they did an outstanding job putting that together. I think it's a real strong statement of who we are as a board.
I agree.
Okay.
You know, one of the other challenges technologically is we don't have a raise our hand function that I have anyway on my program. But I would like to look at this from the perspective of our actions, and so that we have a clear statement that these were, if we were going meeting by meeting, that these are motions that we made, actions that we've undertaken. So it would fit, I think, as Representative Dent was saying, to fit that under the action of a particular month meeting, and have it very clear. And I guess from a longer view of the document, are those the only 3 actionable votes that we took during the last several months?
Those are the 3 products that we produced and voted on over the last, I think we've had 7 meetings this year, 7 or 8 meetings this year.
But we did get many ideas and suggestions in the numerous presentations that have been made. And Krista has woven those into the guidance that we're providing in many cases. So I think we have talked before, and I think it's something this subcommittee on oversight should look at, the need to take action based on what we learn in our meetings. So But I think the report as drafted does try to weave those in so that we really are taking action through our report. Sorry, the smoke is getting to me.
Me too. So a case in point then for our existing meeting that we're on right now, I'll go ahead and try and get my picture up here again. Keep breaking in and out. Something that we could report as actionable is if we actually took up Lois's idea about the composition or the way we refer candidates for the investigation committee. And if we actually took action and said that's our recommendation to the department, I think Lois said it best, but that we make the following 3 recommendations for the period of time of 1 year, you know, or something to that effect, so that we could actually not just be ingesting a lot of information, but could be facile and, you know, quick about making some sort of recommendation to the department that we could later point to as being a function of an oversight board, for instance.
Two quick things, just if people do want to raise their hand, if you do have access to Zoom, if you're, I assume, on Zoom, if you go to the participant tab and click on, or the participant thing at the bottom and click on that, then there's a raise hand feature, but calling out at this point is totally fine as well, but just on that logistically. If
I'm
we
sorry,
do,
yeah, I don't have one of those is what I was reporting, so.
got it. No, and no worries, just wondering if it was logistically easy for people. And then on the Lois, not to get into a debate, but to augment her suggestion about having the 3 a year, to also combine it with Travis and Tyler's concerns about access. Maybe we say three people and 2 alternates, so in case somebody is out sick, it doesn't hold up the whole process, but we have, you know, a set 3 and then maybe again 2 alternates. Just if the 3 aren't available for some reason, if they get sick or out of the, well, no one's gonna be out of the country, but if for some reason they're unavailable. But I think that would be a good idea too.
Ben, you have your hand raised, it looks like.
I do. I'm testing out the feature here, but I do have something to say as well. As far as follow-up from the presentation today, it goes along with the comment that Senator Darneal makes, and that is that inter-rater reliability discussion that was very brief, I think Travis raised it, is really, it sounded kind of technical and maybe a little bureaucratic, but the bottom line is what inter-rater reliability really means is reducing bias. And so much of what we heard from providers themselves is the need, and this crosses over virtually every function within the department, is the need for fair and consistent treatment and decision-making. And you see it with, of course, Jim Theophilus made reference to it as well with foster care, but it's something that is part of our important oversight function. And whenever we see an opportunity to increase fairness, decrease bias in whatever area of functioning we're talking about, I think we need to call it out. So I would make a recommendation that inter-rater reliability be really taken seriously and start doing it in the broad sense that there's some sort of consistent tool for making judgments about providers out of our discussion today.
Thank you for that, Ben. And actually that makes me, I've taken note of that. We'll include that. I'm thinking that might be a good example of where we might not decide to go by the stated outcome guidance alignment that we did last report, but rather look at some of these areas that really cross several stated outcomes. So that one could fall under the early quality learning, supporting providers, as well as with the foster care and keeping children safe and their well-being. But if we flipped it and said, integrated reliability across the board for all of our licensors could really apply to several different outcomes. So that might be an organizational leverage to go in this other direction, which we'll show in just a moment. But I do want to just get back to what's here and just this format, as well as covering some of the content in here and whether the board wants to keep this content in. We've started out our last report to have an administrative guidance section, which was really across the department-wide guidance. And the content I've added in here that stood out to me from the work that we've done this year really was about the call for racial justice in the statement that we will include early in the report, but we can also continue to re-reference that, as well as the budget reduction exercises, since the guiding principles that the board came up with really are, again, agency-wide to provide that guidance. So I've included those pieces here in the administrative guidance piece. I'm sure there's more. Is this content the board wants to keep in this? Do we want to keep this section, or do we want to introduce it differently? Or
Krista, can you, for those maybe more visually challenged, can you zoom in a bit? It's it's tiny. I'm like trying to.
I actually get teased all the time because I like to read things at like size 8 font for myself. So I apologize. I apologize for that. We have a couple other raised hands here. It looks like Ben again and Annie. So jump in with Annie first.
I don't know if this is appropriate or not, but I'm just going to put it out there. I'm wondering if there is a space in this report to reflect back to the last recession and look at sort of the damage that was done and really try to push forward some recommendations around, lessons learned from that so that we can preserve services in all 3 of the areas that we're responsible for. Does that make sense?
It does. I think that is exciting. However, I'm not sure that is because we haven't had a discussion of it, it would be just us coming up with things which not based on a presentation or analysis. And so maybe what we can do, and even in this administrative area might be a good way to do it, some of the guiding principles that or recommendations are looking at racial justice, make, principles around 15% reduction. And then maybe there's a consideration when we bring that up as a kind of recommendation or a critical component for the department to ask them to look back and do an analysis of that and to not repeat those things. So it's less that we're going through and kind of concluding ourselves, but that's something that we encourage the department to talk about with legislators and to talk about in their budget packages and things like that.
Trying to manage several things here. And Ben, I'm going to type that in here. Ben, did you have an additional comment you wanted to make?
No, I'm sorry. I didn't realize I had to lower my hand.
Oh, okay.
Different. I thought it just naturally did that, but I just lowered it. I'm sorry.
Oh, no, that's fine. Thank you. Senator Darden, no, sorry, is that Annie again? Oh, Annie needs to, sorry. We're trying to all figure this out here.
All right, it's an Annie Lee hand if you.
Okay, yeah, Annie, go for it.
I'm sorry, I may have missed this, but I do appreciate Annie Blackledge's point and wonder in terms of the time frame for this report if we still have time as a oversight board to have a discussion about COVID response in a more targeted way, since the legislature is going to be dealing with a lot of those things this session. Again, I may have missed the time frame that this report exactly covers, if we're just coming up to this meeting, or if the next couple meetings will also be included.
We'll be reviewing this next meeting, then the November meeting actually will be the final review and approval for submission for review process the 2nd week of November. So it should cover our full year. I'm documenting that we might want to add in here, particularly when it comes to the budget piece, to reflect back on the last recession, lessons learned for that time, but including our guiding principles that the board worked on early in the year. And another piece was that network administrator model evaluation and funding that we had discussed, which is part of the budget principles. I don't know if that needs to be a its own bullet point here, but we did have a whole meeting to discuss this since it is in legislation. Any thoughts?
I think just to follow up on Annie's question or Annie's point, on the yearly calendar we have for October TBD in terms of the topic, and it sounds like, and Annie, correct me if I'm wrong, that your recommendation may be to have response to COVID be that October meeting, and so that and recession, and so that we are able to comment on it and learn and to comment on it.
Yes, that was my suggestion, Representative Sen. And I think in particular, I think this group might have some strong thoughts around how race and racial justice intersect with our priorities under COVID response. So I think it would be a very interesting conversation for sure. I think there's going to be a lot of discussion about what are the priorities given the big looming economic deficit that we're facing, and so I think it would be important to discuss that.
And we were talking a little bit in preparation too for this meeting about, so we submitted as a board principles to the department around how we recommend that they do their 15% cut recommendations as needed. And I think those recommendations were very valuable and were kind of that high level and some really good strategic and principle components. And I think being an oversight board for DCYF, our control and our influence is on DCYF. And one of the difficult places, and I'm just kind of putting that out there, is that beyond us advising them on what they submit to the governor, the rest is kind of the legislature, and what is the legislature doing with the budget recommendations and packages asked by DCYF to the governor giving to the legislature, and then the legislature responding and coming up with our own. So there's just a little bit of a tricky, who are we advising about what? And I think our guidance probably still stands about the budget reduction exercises as our key principles. And I think, it behooves us to share that more broadly than with DCYF. But in terms of us advising on kind of budget and things like that, I think that's where it gets a little tricky too.
It looks like Diane, you have your hand raised.
Yeah, and I may be a little bit far afield, but I'm thinking about things like that where we had the principles about the budget reductions. We spent a lot of time thinking about those. The thing that I wonder about, and I don't know how to work this into the report, but it's closing the loop, finding out kind of what were the actionable steps that DCYF did and did we actually have any impact or say in that? I mean, we make these statements and then we don't really, I don't see where that closed loop comes in, and maybe this is for the oversight discussion later, but I didn't know if there's a way to kind of, maybe that's something we can talk about at the October meeting, but I just wanted to express that concern.
I appreciate that. We do have some knowledge of the principles that they decided on were their top principles, that some is reflective of ours, but not completely. So I do think that that is a good thing to acknowledge and also to bring up in our subcommittee oversight strategy discussion. So I appreciate that. Annie Lee, do you still have another comment, or is it your previous hand up?
Sorry, I'll lower my hand. I was also trying to help my son get online in school, so I stepped away for a minute.
Totally understand. So we have, again, this administrative guidance section at the beginning, as we did last time. I'm sure there's others if we want to think about those before our next meeting. We are running out of time too. I want to acknowledge that. One suggestion I do have, if there are board members that want to meet with staff to help kind of revisit takeaways we had from previous meetings and flesh this out more, we are very open and welcome that, so we can have more feedback. As you'll see, just before we do close for the day, I guess, I want to give everyone time. If you want to write written feedback too, please do, and send us before our next meeting so we can work on this draft. I'll probably send an email out to ask who might be interested in more of an active engagement on editing the report. Just one thing I wanted to point out, because I didn't want the board to make a decision on, is again, this is organized in a way that's by individual state outcomes that are listed in the legislation. I provided all of you a second option for the guidance section, which I'll pull up here quickly if I can have access to it. And again, this is more for the purposes of trying to streamline our report and really get our priority points across, so that whoever is reading it and is going to use it for decision-making purposes sees that thinking and that strategic thinking based on the conversations we've had. So I'm going to pull up this second organization, and there's probably ways to provide this that are a little bit cleaner as well. But this is an alternate option in which we, instead of doing it by stated outcome, we do it by guidance, and then we acknowledge a list of stated outcomes that it will influence. And the thought here is that we have several pieces of guidance, I believe, that'll come out of our meetings. Some touch on more stated outcomes than others, and we could prioritize them in that order to say biggest bang for your buck. If you address the call for racial justice action based on what the board has come up with, you're going to influence your performance on stated outcomes in a grander scale than some other guidance we provide. For another example I provide is the in-person remote family visitations that we heard about in JR that are not currently happening, but we heard about earlier in the year with family time with the child welfare. They're not happening similarly across all divisions, and so there's an expectation to do that, and then listing the state outcomes again that this would affect. So I would love to get people's opinions on that now, or vote on that now, so we can move forward with a specific format, or we can wait till our next meeting if there's a preference. Ruth, I think you're muted.
My apologies. Given the feedback we received on our first report last year about the number of recommendations that we made and the length of the report, I think wherever we can consolidate and make things very focused and concise and not have as many recommendations, I think that would be helpful in the reception to the report.
Thank you. Yeah, and I would argue that'd be the latter. So it'll help us prioritize and also show the guidance we provide that it hits on more performance outcomes than others. If that's, is there anyone that's against that idea? So it would be a different format than last year's report, just in the guidance section at least. No? Okay, so I'm going to go ahead. I'm going to format our report in that way, and I'll work on filling in more of those pieces. I will send an email out to board members that want to help us engage in more in the editing and content of that report. Otherwise, you'll see it on our next agenda. And with that, that gives me something to work on in between, and I'll hand it back to the co-chairs because I know we are out of time. So I want to make sure we respect that. Yeah.
Krista, I'm sorry, this is Stacia. Just one quick thing, that if members are want to provide written feedback, that they send it to you, to the staff, not copying everyone and not replying back. If someone should send it to multiple people, not to reply back with a reply all, so you don't get any issue of a email meeting, essentially. Thank you.
Thank you, Stacia. Yes, we will control to make sure that we're not doing board action through email communication due to the Open Public Meetings Act. Thank you. Okay. Co-chairs, I hand it over to you for closing
Okay, well, it's been a very productive and robust discussion. I really appreciate the opportunity to focus on childcare, and think we have gotten some very good ideas to carry forward into our report. So I just want to thank again everyone who participated in that, and particularly Lois for putting together the panel with Krista and moderating it. So thank you, Lois. Clearly we will have a very in-depth discussion of the report next meeting. So thank you, Krista, very much for the draft. I think it's a great start.
Yeah, thank you, everybody. I echo Ruth's comments, and I do want to invite everybody again with the caveat to just send it to Krista and Nicholas, but to bring forward things that you remember that were without conclusions or guidance from previous meetings, so that we can include them and discuss them in our content documents. We can look back at minutes, other things that have triggered or reminded us, and then we can evaluate those and talk about those at our next meeting. And again, thank you for everybody for being here and spending so much time with us as we acknowledge that this is a really difficult time for so many families. I think that so many of the meetings we've been on, and as we've had many personal experiences, just even here today, people are juggling their work, their kids, their health, the fires in the community, and all sorts of their own mental health, and just really appreciate how committed people are to this group and the work that we're doing here. It means a lot to me personally. It means a lot to the department, and I know it means a lot to the families and the clients that are impacted by the work that the department does. So just a heartfelt thank you to everybody, and please continue to be healthy and safe, and look forward to next meeting and discussions. I think, again, just those last things, if you would like to be on the Oversight Board subcommittee, to let Krista know. And if you'd like to be on a report subcommittee, a temporary report subcommittee, let Krista know as well. Any final comments, Krista? Okay.
No, thank you all, and thank you, Lois, and thank you all the providers on the panel. It was a great engagement, so we appreciate it and continue to look forward to future engagements as well.
Bye, everyone.
Bye.